I'm gonna go to bed this month.
Good afternoon.
Good afternoon, Madam Chair.
Welcome to the Finance Committee. Today is Friday, March 1st, and we will hear the bills in this order. Senate Bill 938, Senate Bill 825, Senate Bill 863, Senate Bill 875, Senate Bill 896, Senate Bill 999, Senate Bill 751, and Senate Bill 809, all subject to change because you will see that our members come and go to do bill hearings in other committees. Thank you all for being here. We appreciate that you've come to testify on bills. We ask that the sponsor take as much time as they need and everyone else gets 2 minutes. Please respect that. Thank you very much. Senator Augustine, would you like to come to the table for Senate Bill 938?
Yes, ma'am. Yeah, some witnesses too for it.
Your panel.
Yeah.
Thank you.
You want to come up? Sure. Yep, come on. Oh, yeah, you're awesome. Great. Wonderful. Glad you can make it. All right. Thank you, Chair Beidel, Vice Chair Klausmeyer, and members of the committee. Senator Malcolm Augustine here on behalf of Senate Bill 938, Maryland Department of Health Public Education Campaign on Prostate, Lung, and Breast Cancer Prevention. Colleagues, we know that early detection is very important towards the survivability of cancers, and particularly these cancers that I've mentioned. We also know that we have real health disparities on survivability for different groups of folks. And this piece of legislation is seeking a public education campaign with an emphasis on populations that are disproportionately impacted. And I want to just walk through the three of them very briefly to sort of demonstrate that. So we know that breast cancer, if there's its early detection, 5-year survivability rate is 99%. For Black women, that number is closer to 82%. We also know that for the age from 50 to 74, the number of folks who are being screened for both is kind of equivalent, is around 75%, but that there is a higher mortality rate for Black women, again, that's associated with them dying from breast cancer, disproportionately impacted. When it comes to prostate cancer, and I just must say to this committee, I want to thank this committee as having worked in the past with folks to try to remove the costs associated with doing these screenings. So it's very important, well done by this committee, but we still aren't necessarily getting where we want to get as far as folks actually getting the screenings done. And so what we find is that a 5-year survivability rate for the whole for prostate cancer is 99% is the case. But what we also though know is that a significant number of folks aren't actually getting the screenings. So the number for screenings within that is like 40% for those at the 55 to 69 age group who should really be getting these annual prostate screenings. But we also know that African Americans are disproportionately impacted from a mortality standpoint, in that they are 2.1 times more likely to die from it if they do have prostate cancer. And similarly with lung cancer, we find that with early screening, the survivability rate really goes significantly up, but that we still have this disproportionate group amongst African Americans in particular who that their mortality rate is much worse as it pertains to the death when they do have lung cancer. And so what we want to make sure that we do is try to, with the public education campaign, make sure that we are getting everybody this early screening to increase the survivability of all, but to make sure that those that are disproportionately impacted, we're really concentrated, focused in on making sure that we reach those groups. Now, in the testimony, you'll see from MedChi that they had asked for a consideration as well for colon cancer, which I'm open to. We can have conversations with the Department of Health, who I've been working with on trying to come up with this campaign in a positive way. And the other, something else that is clearly in the testimony that I think, is worth considering is that we have talked about this coming out of the Cigarette Restitution Fund, and there have been some concerns about the utilization of that fund. We're working obviously with the Department of Health to make sure that what we are doing is targeted, but in keeping with what we are trying to accomplish with these funds that are there. So I think that we can make this work well in that regard. And there's also already within the Cigarette Restitution Fund, there are other uses that have been there beyond just cigarette cessation and other things that are more directly that are public health related, similar to what this is. And so lastly, I have been meeting with the Department of Health, and I'm comfortable with the suggestions that they have about how we may modify this to make it work, still be successful, do the kinds of things that make a lot of sense, but that fit within their vision of what they're trying to do. This is a Black Caucus priority bill. You have a letter because this is really very important in impacting the over 2 million Marylanders that we have who are of African-American descent. And so I would ask for a favorable report as it will be amended, working in concert with the Maryland Department of Health. Thank you. Dr. Yeah.
All right. Good afternoon, Chair Bidle, Vice Chair Klausmeyer, members of the Senate Finance Committee. Thank you, Senator Augustine. For the record, I'm Dr. Nilesh Kalyana-Raman, the Deputy Secretary for Public Health at the Maryland Department of Health. And here, happy to testify on behalf of the department in support of Senate Bill 938 with the amendments that Senator Augustine noted. We certainly support the bill's intent to develop and implement a public education campaign on these issues: prostate, lung, and breast cancers. Lung cancer being the most common, breast the second most common in women, and prostate the second most common in men. And as Senator Augustine noted, some particular disparities in terms of mortality, in terms of deaths amongst Black women and Black men from breast and prostate cancer respectively. And so, this is certainly a timely bill in terms of looking at how we can improve screening rates for this. Some of the items that we had highlighted that we were talking about and that we were in agreement on in this, I believe is around making sure that this is synchronized with our other efforts. And so particularly making sure that we are working with our local health departments and others in the local space to be able to get this information out to communities. We certainly rely on them to know their communities and know who to reach out to within those communities. Looking at, we always do feedback and stakeholder involvement. And so that's a built-in part of how we do this work. And then, of course, in terms of reporting, incorporating this reporting into the Cigarette Restitution Fund and highlighting it so that there is visibility on it, but not creating a new or separate reporting requirement. And then lastly, changing the effective date so that we can have a little bit more predictability in terms of how we're getting funds out to FY25 recipients who are already we're already working to get those funds out. So overall, these are changes that, as I mentioned, we worked with Senator Augustine on, and I think we're in general agreement on. So we're very happy to support this bill.
And are you Mr. Morrow? Eric?
Yes.
Thank you. You can go.
All right. Good afternoon, Chair Bidle, Vice Chairman Klausmeyer, and members of the Finance Committee. My name is Eric Morrow, and I live in Bowie, Maryland. I'm a 20-year Air Force veteran and was diagnosed with stage 3B prostate cancer in 2021 at the age of 49. Had either my primary care physician or I known more about prostate cancer during my 40s, it's likely I would have received timely PSA screening and my disease would have been caught before spreading to my lymph nodes. I'm here on behalf of Zero Prostate Cancer to testify in support of SB 938. After decades of decline, prostate cancer deaths are on the rise. Maryland has the 4th highest incidence rate for prostate cancer in the country. In Maryland this year, the American Cancer Society estimates 6,150 men will be diagnosed with prostate cancer and 660 will die from it. African-American men, male veterans, and men with a family history are classified as high-risk groups for prostate cancer. 1 in 6 Black men will be diagnosed with prostate cancer in their lifetimes, compared with 1 in 8 men in the general population, and they are more than twice as likely to die from it. They are also more likely to be diagnosed at a younger age and with more aggressive disease, like I was. Veterans are 1.5 times more likely to be diagnosed in the general population, with 1 in 5 veterans developing prostate cancer in their lifetimes. They are also more likely to have an aggressive form of the disease. SB 938 requires MDH to work with prostate cancer-focused organizations, including Zero Prostate Cancer, to develop and implement a public education campaign for prostate, lung, and breast cancer. A 2019 study from the American Journal of Men's Health found that the majority of men are not completely informed about the PSA test from their physicians. It is critical that clear communication tools are provided to both patients and providers. SB 938 would give the Department of Health the ability to use communication tools and messaging to implement the public education campaign and improve prostate cancer awareness and outreach. Again, on behalf of Zero Prostate Cancer, we request a favorable report. Thank you for your time.
Thank you. Do I have Senator Washington? We have some questions for the panel.
Thank you, Mr. Chair. Told you. No, I'm joking. Just after hearing the bill, I want to just say thank you, Senator Augustine. This is a really, really, really great bill and definitely very timely. I thought it was we needed in our communities. And, my 3 of my uncles had prostate cancer and they all survived from it. And it was all recent, all in one time, and they didn't know it was coming or didn't get detected from it. And so in our communities, this is so important. I do have a question for the department though, which is, why can't you do this now? And why is it taking so long to do something like this? Can you just answer that for me?
Sure, happy to, Senator. So we do a lot of work around a variety of cancers, particularly breast. We do lung, prostate, a little bit less so, and that has to do with some of the challenges in terms of how screening has been recommended. There's a lot more variability in what the screening recommendations are, in contrast to breast cancer screening, which is much clearer. And so this is an area, it's timely, we do need to invest more. And so we'll definitely agree that needs to happen now.
Yeah, but what prevented the department from doing this in the past? Is it just the changing in the screenings, or what has prevented you guys from doing it in the past? And I know we're looking for it, which is great, sure, but it's just, it's a disservice to our communities that they don't know a lot more about this already.
So it's not that we don't do anything on this front. It's just that
I didn't mean it that way.
No, I understand. It's just that we haven't put the I think the level of energy and money into this particular cancer, right? And it comes back to the issue of our recommendation really at this point is talk to your doctor, because there isn't a clear, like with colon cancer screening, like at age 50, do this. With breast cancer screening, at age 45, do this. And I think that's been and that will continue to be the challenge, even as we implement this, is that it really does have to be, please talk to your doctor about this. And so I think that's the smushiness that we've had to deal with in terms of guidance and the variability of guidance.
Thank you.
Thank you, Senator. Senator, I've heard some things about amendments. One is to add colon cancer. Have you requested amendments? Are you going to submit those?
I will.
Okay.
So I have the ones from the department. I'm going to consult with them about the colon part as well.
Okay.
And then I'll definitely submit amendments to the committee.
Thank you, Senator. Senator Ellis.
Yeah, thank you. Thank you, Madam Chair. And thank you so much for this bill, Senator Augustine. And, is that Mr. Morrow?
Yes.
Yeah, so you talked about the disparities for Black men. I'm a Black man. And you also mentioned veterans. I'm a veteran. So it's like my risk is really high and in these categories. Did I hear you say correctly that doctors don't inform these folks about PSA testing? Could you?
Sure, I can expand a little more on that. It's not that they don't inform folks. In 2012, the U.S. Preventive Services Task Force, which is the body under the CDC that recommends all the preventive screening in the United States, revised their instructions for PSA screening from 40 years of age to 55 years of age. Mm-hmm. And there was an acknowledgement in that report that African-American men are at higher risk, but they said because there wasn't a large enough sample size in the study group that they were looking at, they were unable to provide a separate recommendation for African-American men. And what this means is many primary care providers are not aware that African-American men are at higher risk, and therefore they don't recommend PSA screening until 55. And that was the case with me. I started asking about PSA screening probably in my mid-40s and was told, you don't need it yet, you're too young.
Yeah.
And that was a consistent refrain for a number of years until I went in for a colonoscopy. And when I woke up from the colonoscopy, the doctor said, your colon looks great, your prostate's a little enlarged, you might want to see a urologist about that. And so when I went to the urologist and had my PSA checked, I got a call back several hours later and the doctor said, you need to come in for a biopsy because anything over a 4 is considered high for PSA. Yours is 250. So if my PSA had been checked during those intervening 6 years, it's likely they would have caught it sooner.
Yeah, yeah. So I'm curious, so if a patient asks for a PSA, they can get it.
If a patient asks for the PSA, they can get it. Insurance may or may not cover it because it's not recommended until age 55. And
But I thought there were some exceptions for like if you have a family history of prostate cancer or anything like that, you can get it earlier.
I believe that's the case, but
That's the case?
but also some physicians will still tell you you don't need it, even if you ask for it,
Yeah.
and tell you that you're too young.
Yeah, so this bill will do what? The educational campaign will target the individual or the doctors to let them know to recommend this testing. Who's the,
That's for the department.
okay, doctor.
Yeah.
So thank you.
So yeah, we do this to both,
Both, okay. Okay, great. Well, thank you. Yeah, thank you, Madam Chair.
That
Madam
brings-
Chair,
Senator,
yeah, it's a Friday in Lent and Senator Reedy has those fries and it's really messing with me. So I'm very upset with him. I'm sorry.
Senator Reedy, you've been reprimanded. Will this affect insurance at all? Like if a test isn't recommended, will insurance still pay for it if you insist to have this done?
that's always the challenge, is that
Yeah.
this bill won't affect insurance, and that's a much bigger and different question. Now, there are ways to code tests and be able to say that an individual is at higher risk. But that's, as you know, is a difficult question for me to answer because of the variability of insurance coverage.
Hopefully that's part of the education process. So
Yeah.
thank you very much for this very good bill. I have 2 more witnesses, but there are no more questions for this panel. Nishana Kess, are you here? I don't see Nishana. And then Lance Kilpatrick.
Thank you, Madam Chair, members of the committee. For the record, my name is Lance Kilpatrick. I am the Maryland Government Relations Director for the American Cancer Society Cancer Action Network. On behalf of our constituents, I want to say that we strongly support the intent of this legislation. And I want to thank the Legislative Black Caucus for bringing this forward because it is an incredibly important issue. But I would also say I have some reservations about how the proposal is funded. A multi-year public education campaign targeting communities disproportionately impacted by prostate, lung, and breast cancer is a worthy venture that should be funded. In fact, my organization is working with Congressman Ivey's office to have a prostate cancer screening event in April in the district. That's how important we believe it is to get to the local community and target it. But diverting monies from an already underfunded cigarette restitution fund, which supports numerous public health initiatives, should not be the funding vehicle. The CDC already cites Maryland as spending less than half of what they would recommend as a best practice investment. So I stand ready and willing and able to work with the senator and the caucus and MDH on figuring out a way to do this. But I really hope that they don't divert funds from a situation that is already making do with much less than they should in order to get this done. So thank you.
Thank you. Do I have any questions for this, Senator Owens?
So Thank you for your testimony. So what organization are you with, sir?
The American Cancer Society Cancer Action Network.
Okay, so you know a lot about cancers, right?
I I would say the organization knows a lot about cancer. I know a little bit about cancer.
Okay, a little bit, probably much more than I do. So are you aware that smoking causes a lot of cancers?
Yes, sir.
It's not just lung cancer, but a lot.
That
So
is
a lot of
correct.
these cancers are directly tied to smoking.
Absolutely.
Are you also aware that African Americans are heavily targeted when it comes to advertisement from tobacco companies?
Very much so. In
Okay.
fact, we recently participated in the mock funeral in Washington, DC
Yeah.
to get the FDA to ban menthol cigarettes specifically because of the targeting
Yeah.
to
Okay.
African American communities.
So why can't we use tobacco restitution fund that's meant to help in this area to keep Black men especially from dying?
There's no question. I'm complete 110% in agreement with
Okay,
you,
thank you.
Senator.
Thank you.
My point, Madam Chair, may I finish my statement to the senator?
Yes.
Senator, my point is not that we shouldn't be funding this. We should be. The cigarette restitution fund should actually be larger than it is now, so we can do the exact things that you're talking about. I just don't want to see money diverted that's going to harm other programs potentially by not having enough funding.
So,
Thank you for the question, though, Senator.
thank you. Senator, there is a proposal in the House to increase the tax on cigarettes, so maybe we can find new funding. But I think it's an important issue and you make a very good point. Thank you. And thank you, Lance. That ends the hearing on Senate Bill 938. I see no other questions. Next, we have Senate Bill 825, Health Facilities Delegation of Inspection Authority. Senator Kramer. Now, do you have a panel, Senator Kramer?
I don't know if I have a panel, Madam Chair, but I think there may be somebody from Montgomery County here, or maybe there's not.
I have,
Okay, well, it sounds like Mako wants to come up and keep me company.
okay, and Tammy Bresnahan
Thank-
signed up. I don't see
Oh,
Tammy.
and AARP
There we
as
go,
well.
AARP.
They looked and thought I looked very lonely.
Thank you, Senator Kramer.
Thank you, Madam Chair, Madam Vice Chair, members of the committee. Ben Kramer to introduce Senate Bill 825. Colleagues, you may recall early on in session, we were having a conversation about that I expressed my concern about the total and complete lack of inspections happening in our nursing homes here in the state. I brought up the fact that in Montgomery County, for at least a decade, Montgomery County had an agreement with the state to perform the nursing home inspections in Montgomery County on behalf of the state. That memorandum of understanding expired October of 2021, and the county has not been able to get the Department of Health to renew that memorandum of understanding, and the county is no longer permitted to inspect the nursing homes in Montgomery County, and the state is simply not doing it. So we have the most vulnerable in our population in nursing homes, and we know what a risk it is for these vulnerable residents of our state to be in a nursing home and it's not being inspected. Interestingly, our friends at the Health Facilities Association of Maryland have submitted written testimony, and in it they indicate, according to year-end 2023 data from the Centers for Medicare and Medicaid Services, only 97 nursing homes in Maryland, out of, by the way, approximately 230 that exist in the state have received their annual survey since the beginning of 2021. Okay? We've got a fraction of our nursing homes statewide that have received inspections in the last 3 years. Since the beginning of 2022, only 63 of those facilities have received their annual inspections. Madam Chair, colleagues, I was not able to get information about the statistics on the nursing homes in Montgomery County for 2023, but apparently in the year 2022, there were no inspections of nursing homes in Montgomery County by the state, a function that used to be done routinely by Montgomery County when they had the memorandum of understanding with the state. And we had heard concerns expressed from the state that they've been underfunded, they don't have the resources, and that's why this critical function is not taking place. Well, colleagues, Montgomery County has said, we get it. Let us go in and do these inspections, and yet the state has refused to allow that to happen. Now, they sent a letter, and I know they're going to be up here shortly to oppose this bill. But in the written testimony they sent, they indicated that this is very complex to create this memorandum of understanding. Colleagues, I am holding a copy of the memorandum of understanding with Montgomery County and the state that is now expired. It is a matter of filling in blanks on a page, like addresses, who's going to be in charge within the county, the approving organization in the state. There is nothing complex about this document that would immediately allow nursing homes in Montgomery County to be inspected. I would proffer to you, colleagues, that this is not a good look for the state of Maryland to have hundreds of vulnerable nursing home residents in nursing homes without any oversight and inspection by the entity that's responsible for it, and that's the state at the moment. And they still refuse to allow a local jurisdiction to go in and at least try to protect their own residents. So colleagues, the bill before you would do just that. If a local jurisdiction asks the state for the opportunity to do the inspections, the state will allow the local Department of Health to go in and start doing the inspections. It's just that simple. Madam Chair, there was some concern in the drafting that, number one, the wording in it might permit every township, every municipality, every village, whatever it may be, to do this. No, that was not my intention for the bill. It was to allow the 24 jurisdictions to have that opportunity, and I'm happy to clarify that in an amendment. Secondly, it also was drafted so that it would include other health facilities, which again is not the intention. The focus is on nursing homes, and I would be happy to provide an amendment that ensures and qualifies the bills about the nursing homes here in the state. With that, colleagues, I am at a loss as to how we are not ensuring the very best for residents in nursing homes. Are you kidding me? And with that, Madam Chair, happy to turn it over to my newly formed panel.
Thank you, Senator.
Thank you to the chair. Thank you to the members of the committee for having me today. My name is Sarah Sample. I'm here on behalf of the Maryland Association of Counties. And I think the senator did a great job of setting up the situation. And we really think that this bill is in the spirit of collaboration between the state and the local governments. We know that everyone locally and at the state level, we're suffering serious workforce challenges. And we know the providers have been experiencing that as well in the healthcare sector. And so we think this will help us collaborate to make sure that we can keep our residents safe in these instances, especially for counties that feel like they're able and willing to be able to step up and be able to fill this gap. So we would certainly urge a favorable report.
Good afternoon, Madam Chair and members of the Finance Committee. My name is Tammy Bresnahan. I am the Senior Director of Advocacy for AARP Maryland. Sometimes I do feel like I'm the long-term care person, but yes, Senator Kramer could not have said it better. I've been on a couple of work groups around assisted living, small assisted livings, nursing homes in the last couple of years. And we heard the same criticism from Anne Arundel County AAAs that they used to have this MOU where they were another set of eyes on the assisted livings, and that MOU was not ratified or redetermined after it expired, and they were concerned about that. That concerns me. Sometimes I scratch my head at what the department is doing, and this comes from somebody who worked in a very large department for over 26 years. I know you're short-staffed. I know you take pay cuts. I know, but these are, like Senator Kramer said, our most vulnerable population, and they need oversight. ARP believes that intra-agency cooperation is necessary. Open book policies of transparency inspections into what happens in nursing homes can be helpful when providing and monitoring oversight and the quality of a resident's health and welfare. For those reasons, we ask for a favorable report on Senate Bill 825, and we thank the senator for bringing this bill forward.
Thank you. Thank you to this panel. Are there any questions for the senator or for this panel? Thank you very much for being here.
Thank
Next.
you, Madam Chair.
Thank you. Next, we have Laura Howe, who's favorable with amendment.
Good afternoon, Madam Chair and members of the committee. I'm Laura Howe with the Maryland Association of Community Services. Actually here on behalf of the Maryland Developmental Disabilities Coalition. We are here favorable with amendment. As the sponsor mentioned, there's one small issue that we need to have addressed. The bill as drafted, because it includes related institutions, would include group homes that are licensed by the Developmental Disabilities Administration. We know that's not the intent. We appreciate the sponsor's willingness to put an amendment forward to address that issue, and we urge you to adopt that amendment. That's it. Thank you.
Thank you. Thank you, Laura. Any questions for this witness? No, thank you very much. Now I have Dr. Kaliana Ramos here with an unfavorable testimony.
Good afternoon. Seems I get the hot seat. So I want to acknowledge that, we know that there's a backlog of nursing home surveys and investigations here in Maryland. It's not unique to Maryland. In fact, it's important in other states as well, but that does not absolve us of our responsibility to address this and pay attention to this issue. I just want to highlight that the department is working to implement a plan. We have 3 strategies in place. We've improved our hiring and we've decreased our vacancies to less than 10%, and the nursing home surveyors, the governor's allowance has funds for both increase in additional and permanent staffing of surveyors to allow us to both keep up with growth and catch up with the backlog, and temporary funding of $3.9 million to clear out the backlog, or at least the large bulk of it. And saying all of that, we're also open to partnering with other counties to consider a way forward. I know Montgomery County is obviously interested in this, and we're happy to talk with them. Follow up from a prior conversation earlier in the session, as Senator Kramer had mentioned, we reached out to Montgomery County. We're waiting to hear from them as to a time for a meeting, but we are happy to discuss how to move forward with this with both Montgomery County and any other county. So I think in our opinion, we really don't think that legislation is necessary to be able to sit down with counties. We're prepared to do that.
Thank you, Dr. K. Do I have any questions? Oh, Senator Kramer.
Thank you, Madam Chair. Doctor, I very much appreciate that the department is happy to talk with local jurisdictions. And you stated that you don't believe legislation is necessary. Doctor, Montgomery County has been trying to talk since October, actually well before October of 2021, when the MOU expired. To date, the county has not been able to work out being granted the authority to inspect nursing homes in Montgomery County. Would you please share with this committee, since the expiration of that MOU, how many nursing homes in Montgomery County have been inspected?
Senator, I'd have to get the exact number from Montgomery County with you, but I understand your point. That's why I'm telling you, and we're working on sitting down to figure this one out.
Well, how is Montgomery County going to be able to provide you with information about how many nursing homes have been inspected when they have been cut off from doing those inspections for 3 years now?
Oh, Senator, we're not asking for them for that information. The goal of sitting down is to figure out how to get to a place to make this happen.
So going back to my actual question, how many nursing homes in Montgomery County have been inspected since the expiration? Is it possible that there is not one nursing home, and my understanding is that by law, it's supposed to be every 12 months, once a year, this inspection take place. Is it possible that in all of 2022, not one Montgomery County nursing home has been inspected?
I would be surprised by that, but I will follow up with you with that data.
And if you are surprised by the accuracy of that, would you then say, you know what, Senator Kramer, we need this bill to pass? If in fact your surprise comes to fruition, would you acknowledge the merits and the importance of this bill?
I'm here to tell you that we're ready to talk. We don't need a bill on our side to talk.
And would you share with this committee how many Montgomery County nursing homes were inspected in the year 2023?
I will get that information and share that with the committee.
And would you be once again surprised if it turns out none were?
That would be yes.
Okay. Let me ask you this. You keep referring to a willingness to talk, and yet we have now gone years with uninspected nursing homes. So evidently talk has not been sufficient, hence the bill before you. And I would share with you that I think it's disgraceful. And I think you heard from our friends at the AARP about their concern that this most vulnerable of populations is being left exposed to who knows what by virtue of zero government inspections of these facilities. Now, you all are required by law to be doing it. However, you've acknowledged there's backlogs. It's not happening. Yet you have local jurisdictions that say, we hear you, we get it. Just grant us the authority and we'll do what is your lawful responsibility that you're failing to do. And yet here you are sitting down, looking at this committee and saying, we'll be happy to continue having talks. Sir, it hasn't happened. And that's why this bill is here, because talking is not getting these nursing homes inspected, and we are not protecting our most vulnerable in these nursing homes. So I'm at a loss as to the position that you all have adopted. I'm happy to again offer clarifying amendments to ensure that the intention of the bill is met and that we are in fact protecting nursing home residents. But thank you for coming in. I appreciate your being here. Thank you, Madam Chair.
Thank you, Senator. Do I have any other questions for Dr. Kay? Dr. Kay, thank you. We have one more unfavorable, and it's Seth Miller virtually.
Good afternoon, Madam Chair and Committee. Thank you for your service. I'm Seth Miller. I oppose this bill. I was in an accident. Due to treatment and complications, I was in a few places. My experiences are not unique, but I can testify is. I made complaints with the Office of Healthcare Quality. One complaint was investigated by Montgomery County contractors. The result deadly. Another complaint investigated by Office of Healthcare Quality professionals. The result better. At one place, a nurse chose not to wash a surgical wound, which became infected and reinfected multiple times. The second place was Potomac Valley Nursing and Wellness. It was a dump. They renovated. My first night, I was in a room with 3 other men. One got up and battered a paraplegic. Without full use of 3 of my own 4 limbs, I could not help. It could have been me. The 2 were separated. The nurse on duty would not call police. I told her she would call police, or I would call the state. Police report attached. The next night, my roommate was slapped by a staff member. I called police with my iPhone. The director of nurses and the patient's physician found no evidence of physical abuse. See attached. They get their pay from that place. Had investigators interviewed Brian, they would have seen his face was battered and bruised the way I saw it was battered and bruised when I discharged a month later. They claimed to have interviewed relevant witnesses. I wasn't interviewed. Potomac Valley botched the discharge. The nurse surveyor from Montgomery County said that I told the intake workers some things that I never told them. If they had listened to me, staff would have got their act together. The Washington Post reports Office of Healthcare Quality assessed a fine due to preventable COVID deaths. Staff chose not to isolate known positives and accept known negatives. 10 accepted negative contracted COVID. Of those 10, 3 died. A reporter asked a contractor how they verify that facilities have the required personal protective equipment. The contractor said, quote, "We just take their word for it." I made a complaint against the first facility where my wound was not washed, asking for a professional investigator, not a local joker. A violation was assessed. When I complained to the Secretary of Health, she delegated to the Office of Healthcare Quality to investigate themselves. I complained. The Deputy Secretary was boxed in. I don't remember a thing from the night of the accident. Brian being attacked plays in my head like a broken record. The idea that the Secretary has to give approval is laughable. Look at that nasty letter from her. Thank you.
Thank you for your testimony. Do I have any questions for this witness? Thank you very much. That ends the hearing on Senate Bill 825. And what? And next we'll hear from our Attorney General for Senate Bill 863.
Thank you. Thank you, Madam Chair, members of the committee. I'm joined by Zach Shirley, who is the Chief of the Medicaid Fraud and Vulnerable Victims Unit within the Office of the Attorney General. It's wonderful to be here today. Look, if Senate Bill 825, which we just heard, is about inspection and oversight, I don't take a position on that bill other than saying we do need more inspection and oversight. Senate Bill 863, which is what I'm testifying to, is about enforcement. And I think all of us can agree that we can all do better when it comes to ensuring quality of care for our most vulnerable residents, whether that's in nursing homes or in assisted living facilities. So good afternoon once again, Madam Chair, and members of the committee. For the record, I'm Attorney General Anthony Brown, testifying in support of Senate Bill 863. Senate Bill 863 does 2 things broadly. One, it seeks to establish injunctive relief and monetary penalties for the Office of the Attorney General to seek to enforce more provisions of the already existing nursing home residents' patient Bill of Rights. Number 2, it seeks to extend the nursing home residents' Bill of Rights to assisted living facilities, which does not exist today. Maryland is a nation, as is the nation, is faced with an ever-growing aging and vulnerable populations. We heard a lot about that in the last bill hearing. Many of these residents must seek care and assistance services from long-term care or assisted living facilities and depend upon those facilities to help address their basic needs. Individuals enter these facilities with certain guarantees and assurances from the state that they are as human beings and that they will be afforded certain fundamental rights, like the right to dignity, the right to be free from chemical restraints, and the right to receive adequate medical care, among others. For as long as these fundamental rights have been recognized in statute, the Medicaid Fraud and Vulnerable Victims Unit has protected those rights by investigating and prosecuting the most serious cases of resident abuse, neglect, financial exploitation, and the failure to provide a baseline level of care. Senate Bill 863 seeks the authority to do even more to protect these fundamental rights and guarantees of some of our state's most vulnerable residents. In 1995, the General Assembly empowered the Office of the Attorney General to seek injunctive relief and monetary penalties to stop patient dumping under the Nursing Home Residents Bill of Rights. The General Assembly recognized at that time that the ability to seek injunctive relief in patient dumping situations was critical to prevent ongoing or imminent harm to the vulnerable residents who were suddenly faced with homelessness. The need to address ongoing resident harm quickly and decisively does not stop at patient dumping and is no less critical when addressing other violations of the Nursing Home Residents Bill of Rights. Patients left in soiled diapers for hours or days, patients developing bed sores that expose the bone, and repeated falls resulting in injury are just a few examples of the complaints that we receive every year. I'd like to just add that the bills that the Office of the Attorney General brings you, we do not bring you bills that in the abstract make sense. We don't bring you bills that just intuitively make sense. We bring you bills based on the experience in our office. We bring you bills based on the complaints, the conditions, the concerns that all of our constituents bring to our attention every day, and Senate Bill 863 is one of those. While these cases cry out for criminal and civil legal action by the state, the existing remedies do not address the more immediate needs of the residents who are suffering in these conditions. Senate Bill 863 provides the Office of the Attorney General with the authority to seek a more immediate solution to redress residents' misery by requiring these actions be stopped immediately. Under the bill, follow-up investigations and legal action would continue to occur as they always have, but now the Office of the Attorney General would be able to seek injunctive relief to enforce the rights of residents, stop the offensive behavior, and prevent future harm. Additionally, this bill also addresses the fundamental rights of assisted living residents, as I mentioned earlier, and extends the enforcement authority of my office to assisted living facilities. Assisted living facilities, as this committee is well aware, aid those who do not need the more intensive level of care provided by a skilled nursing home, but who nonetheless require help with daily activities. These residents also deserve protection of their dignity and fundamental rights. Where residents are suffering at the hands of those charged with their comfort and care, the Office of the Attorney General stands ready to take appropriate action. Madam Chair, in closing, it should be noted that the Office of the Attorney General is only seeking authority to enforce specific provisions of these Bill of Rights. The list of enforceable provisions was carefully curated. Mr. Shirley can speak in more detail to that, to include only those violations that are likely to result in criminal or civil enforcement actions by the Office of the Attorney General. Indeed, the Office of the Attorney General understands and appreciates the active role the Office of Healthcare Quality plays in oversight of the long-term care system. It's not our intent to duplicate the efforts of OHCQ or to usurp any part of that office's role. Instead, what OAG seeks is the power to put a stop to the most egregious violations of the rights of long-term care residents. So as the Chief Legal Officer of the state, Madam Chair, I urge a favorable report on Senate Bill 863. Thank you.
Thank you, Mr. Attorney General. Mr. Shirley, you want to go next?
Good afternoon, Madam Chair and distinguished members of the committee. My name is Zach Shirley. I am the Director of the Maryland Medicaid Fraud and Vulnerable Victims Unit in the Office of the Attorney General. For 45 years, our unit has stood guard against those who would abuse and neglect Maryland's vulnerable adults. It's important work that I look forward to doing every single day. But if there's one thing that keeps me up at night, it's the complaints we receive from families regarding what I refer to as systemic abuse or neglect in Maryland's long-term care facilities. For while abuse by an individual care provider is often a simple case, Systemic abuse in the form of chemical restraints or long-term neglect resulting in bed sores to the bone, infestations, and repeated infections caused by inadequate hygiene can be far more insidious and difficult to rectify. Often there is no single culpable actor. Rather, systemic issues with staffing, management decisions, and inadequate resources are at the root cause of the problem. Where abuse and neglect is systemic, our tools to address it become less effective. Investigations become longer and more complicated, and the results take time. Knowing that in cases like I just described, the victim or victims are still suffering while we develop our case is what motivates me to stand before you today. For unlike crimes such as robbery, arson, or murder, where the crime is over while being investigated, systemic abuse and neglect can be ongoing. Our toolbox of criminal and civil enforcement powers can be effective, but they're not immediate, and every day that it takes can be another day that residents are suffering. Injunctive relief is faster and its remedy is more effective, putting a stop to harmful practices rather than imposing purely monetary relief that can never adequately address the harm. Maryland law already provides that nursing home and assisted living facility residents have certain fundamental rights that are guaranteed. By granting the Office of the Attorney General power to enforce those rights and to seek injunctive relief from the courts, we can leverage those fundamental guarantees to more quickly address problems of systemic abuse and neglect. Senate Bill 863 gives the Office of the Attorney General the power to put a stop to resident suffering at the front end of an investigation while continuing to investigate, develop, and craft a solution. For this reason, we urge a favorable report.
Thank you, Mr. Shirley. I have some questions from the committee. Senator Washington.
Thank you, Madam Chair and Mr. Attorney General. Great to see you, and thanks for this great bill, I think. Right now, do you currently have oversight over these facilities at all? Is this this would be brand new for you, for the office?
No, we have a role to play in oversight, not identical to OHCQ. But when we have the requisite belief and information to go into a facility to conduct an investigation, whether it leads to criminal or civil enforcement action, we have the ability to do that. Unlike OHCQ, our primary mission isn't to do oversight, supervision, quality assurance, and quality control. We go in for the purpose of looking at whether or not, there's wrongdoing, whether or not regulations are met or not, and do they harm patients? And then we, with an eye towards potential enforcement activity. As Mr. Shirley mentioned, though, we go in, we see these systemic or and sometimes individualized cases that are creating harm and misery, but we haven't fully developed a case that we can stop it. But we see the need for immediate relief. This bill gives us the ability to not to go in like we're already going in, but to seek the relief in court to stop that action.
Got it. And so you mentioned the current tools that you have. This one obviously isn't a current tool that you have, but you have some tools right now. Is that right?
That's correct.
Okay. And then so I'm reading a comment from MDH or MHCC, actually. It says the Department of Health conducts, just talking about our last bill too, the Department of Health conducts periodic inspections and immediately responds to complaints when patients' harm is alleged. When this happens, is there an expectation that MDH will then provide you with these types of issues that happen at these homes? Is that under the bill that they will then provide these to you if they see something or find something that's harm that's been alleged?
So Senator, if I could clarify, is your question if OHCQ responds to a complaint and finds something, would they tell us about it as well?
Sure, yeah.
In some circumstances, OHCQ, though, does typically address complaints on its own that it receives. If in the course of investigating a regulatory violation or a complaint, they see something that they consider criminal or something that rises to the level that they think we need to take a look, then yes, they will refer a case over to us as well.
Is that mandatory though, that they see that?
No, Senator, it's not.
And well, it sounds like they should, right? I guess my other question is about just, these are multifamily buildings. Does the Office of Attorney General have any oversight currently over all multis to be able to do this? If something happens, there's an alleged issue or anything like that, and a resident contacts the OAG, do you then have this type of oversight for multifamily units?
Are you talking about in terms of in the assisted living context?
I'm just talking about, I'm talking about just outside of this.
No, like in an apartment building?
Correct, yeah, exactly.
No.
Thank you.
Thank you, Senator. Senator Ellis.
Thank you, Madam Chair, and thank you, Mr. General, for this bill and for looking out for some of our most vulnerable citizens in Maryland. I have a couple questions, but first is a technical question. Mr. Shirley, you mentioned chemical restraint of patients. Did I hear you correctly?
Yes, Senator.
What's that? I mean, my first time hearing about that.
So chemical restraints is the use of psychotropic medications in situations where it's not warranted to essentially sedate a patient who's otherwise, some patients exhibit roaming behavior. Some may be combative, and it makes the nursing staff's job harder. And so the answer is not, but is sometimes to give unwarranted or unneeded medication just to keep them quiet.
Yeah. Have you seen a lot of that? Or what? Let me ask more. How prevalent is that from your experience?
It does not make up a majority of our cases, but I will say I joined in September 2019. It was the first case that I had. It was the first one assigned to me, was the use of chemical restraints. And oftentimes, although the complaint may not be simply the use of chemical restraints, it is a symptom of a larger problem. So when we see someone who's, for instance, is prescribed a psychotropic medication, but in their medical records, I can't find any indication that they're schizophrenic or that they have any sort of longstanding mental issues. That lets us know there's something there. But like I said, a lot of times the chemical restraints is a symptom of a larger problem.
Okay, great. Thank you for that knowledge. And Attorney General, the issues with Charlotte Hall Veterans Home, there's a bill going through here to let the Maryland Department of Veterans Affairs most responsible for reporting to us problems. Has your agency kind of go into like Charlotte Hall Veterans Home? Do you have authority to do that? Were you there? Were you aware of any of those issues there going on? And would this bill give you authority to kind of have oversight over them also?
Well, let me start by, I'm gonna let Mr. Shirley get into the specifics on Charlotte Hall. Let me say that this bill does not extend our authority in terms of the types of facilities or even the types of conduct or actions that we are looking at. This really is about a tool, an enforcement tool. We see something, we can now go to court and have something done. So it doesn't change sort of where we are, when we are, and who we're looking at.
Okay.
And I would just follow up and say, the scope of our sort of jurisdiction is any long-term care facility, nursing home that takes Medicaid, and any assisted living facility where abuse and neglect takes place, regardless of whether it takes Medicaid. In the case of Charlotte Hall, because it was primarily a VA home, they also took Medicaid. We could have gone, but that sort of leads to the second answer to your question, which is everything we do is complaint-based. If we don't get the complaint, we don't know about it. We don't do, as OHCQ does, sort of unannounced inspections. We open cases based on complaints. So when that happened last January, February, I went back through our records to see if we had any complaints, and we had very few.
So if you got a complaint, you could go there and investigate.
Absolutely.
Okay, great. Thank you. Yeah. Thank you, Madam Chair.
Thank you, Senator. And Senator Kramer.
Thank you, Madam Chair. General Brown, always a pleasure to see you, sir. And thank you for this legislation. This is a good bill. I appreciate your expressed concern and willingness to jump in to help protect these very vulnerable residents of our state. But wouldn't it be helpful for your office to actually have inspections occurring so that there could be referrals to you all based on the fact that, hey, guess what? We've actually gone in and yes, there are problems, which clearly isn't happening at the moment. Would that not be helpful to your office, sir?
Let me answer that, Senator.
As diplomatically, I'm sure as you're gonna.
I can actually bridge the two questions that you and Senator Ellis asked and the response that Mr. Shirley gave, right? Since we don't do routine inspections and we rely on complaints and referrals and the like, the more complaints and referrals that we get, the more able we are to do our job. The more sources or potential sources of eyeballs looking at conditions in nursing homes and assisted living facilities that could then make a complaint or alert us to a problem certainly would be beneficial.
Perfect. Nope. Thank you for that. And just real fast, if I may, and I don't want to get too far off Main Street and down an alleyway with this, but since we're here having this conversation and it's your office, I know that for years we have discovered we can at any given time have large numbers of people on the Maryland Sex Offender Registry in nursing homes. And that in fact, some of our prisons, when for instance, a prisoner has a stroke, they are placed into a nursing home for recovery and rehabilitation. And I know that several years ago, based on a news report I had seen, local Maryland television report on this issue, it was very difficult, but I finally got information that indicated at that point in time, there were roughly 70 people on the sex offender registry in Maryland nursing homes. And the average age of those offenders was 55 and under, yet the average age of the residents was 65 and over. And there was considerable concern about the vulnerability of folks with cognitive defects and physical disabilities being exposed to large numbers of people on the sex offender registry residing in the exact homes without there being any requirements of the nursing homes to ensure protections or to even let the families or the residents know so that they could at least try to, secure some level of protection for their loved one or for themselves. And that in fact, there had been problems directly associated with that issue. So I don't want to get too far down that alleyway, but based on your concern for the well-being of these residents, perhaps it might be something that your office might want to take a look at as to how this is happening and the total lack of precautions and safety for our residents with all of these folks on the sex offender registry that are in the room, could be in the room right next door in a nursing home. So thank you. I appreciate your being here. Like I said, always good to see you, sir. Thank you, Madam Chair.
Thank you, Senator Kramer. Senator Ellis has another question.
Yeah, thank you. Really quick question, Madam Chair. Thank you. Following up. So your investigation is based on complaints. So do you have like a sign at nursing homes saying that you can complain to the Maryland Attorney General's office? Is that sign, like, do you have that signage to let people know about their rights?
I don't think that type of signage is compulsory. We typically leave our business cards behind when we interview a resident. Oftentimes we will visit a facility with multiple investigators, talk to multiple residents, and leave our information. But in terms of a public posting, no.
Could we put that amendment in this bill to require nursing homes to put a sign up?
I don't think we'd be opposed to that. I'm not sure how that would be received by the industry, but I mean, that's just something to take into consideration. But yeah, because what you're asking is, does the public, families and residents or families of the residents and residents know that we're here to help? And certainly we would support any effort to promote that.
Okay.
Information for the public.
I'll follow up with that. Thank you.
If I could just follow up, we recently changed our name from the Medicaid Fraud Control Unit to the Medicaid Fraud and Vulnerable Victims Unit just for that reason, because we didn't think people knew we were here.
Thank you, Senator. I will mention that there are signs in nursing homes about contacting OHCQ if you have a complaint. So, but not the Attorney General. I didn't have any idea people could reach out directly to you for issues. So that was helpful today. I have some other panels. Thank you very much to this panel. Thank you, Attorney General.
Thank you, Madam Chair, members of the committee.
Thank you. Tammy Bresnahan and Christina Moore are both favorable.
Hi, good afternoon again. I'm Tammy Bresnahan. I'm the the Senior Director of Advocacy for AARP Maryland. We support Senate Bill 863. We thank the Attorney General for bringing this bill forward. And just indulge me for a second. You have my written testimony, but again, in 2005, the Maryland Office of Healthcare Quality entitled a report, Maryland's Assisted Living Evaluation. The report confirmed that residents in assisted livings are frailer and have more memory issues than when OHCQ began regulating assisted livings in 1996. They estimate that 2/3 of residents in assisted living programs have moderate to severe dementia. Some of them take 9 to 14 drugs per day. The reason I'm telling you that is because I heard the term patient and resident used interchangeably. And assisted living is private pay and only regulated by the state. And most of those people should be considered a resident and not a patient. So when Zach says that they are, that they're drugged, that means that maybe that assisted living needs more of a medical background. And so when we walk into some of these assisted livings, we cannot tell the difference between a nursing home and an assisted living. And they're regulated completely different. Nursing homes are regulated by the federal government and the state government, and assisted livings are only regulated by the state. And again, those regulations have not been updated since before 2008. So we have a frail population, a vulnerable population. And let's just give you an example. Her name is Tink. She was in a facility on the Eastern Shore in memory care, paying $5,000 more per month for that memory care, and she broke her femur. How do you do that in memory care? Another one in Baltimore County. His name is Charles. He was in a wheelchair. He backed down a stairwell in a wheelchair in memory care. We ask you for I could give you dozens. We ask you for a favorable report. We thank the Attorney General. Thank you.
Thank you, Tammy. And Christina?
Good afternoon, Chairman Vital and members of the committee. My name is Christina Moore, and I'm a Chief Attorney at Maryland Legal Aid, heading the Administrative Law Unit with legal expertise in administrative law and public benefits. I'm grateful to be here. I'm incredibly pleased to request a favorable report of this bill, which provides a basic set of rights for residents receiving services in assisted living facilities and increases enforcement in the form of injunctive relief and civil penalties. Although all clients are important at Maryland Legal Aid, we recognize the intersection of housing and healthcare and the unique vulnerability of clients whose housing and healthcare intertwine. I'd like to share a couple of client stories that illustrate the importance of this bill. Last year, Maryland Legal Aid provided representation to Mr. R, who was unethically evicted and transported to a motel to fend for himself in a practice called patient dumping. Injunctive relief and civil penalties against the facility were available at this point, in which he faced a real possibility of life and death. And this bill would ensure that injunctive relief is available for pervasive systemic issues that residents face prior to that life or death situation. In contrast, I represented an individual who faced an involuntary discharge from a skilled nursing facility that collects federal dollars and advertises services for Alzheimer's patients who require memory care. The facility proactively tried to displace the resident due to their own failure to provide adequate supervision to the patient. Injunctive relief and the prospect of civil penalties would hold facilities accountable to adequate standards of care prior to reaching the point of an involuntary discharge. A resident bill of rights exists for residents in skilled nursing facilities, and this bill would afford the same basic rights to residents of assisted living facilities, including the right to be free from mental, verbal, and physical abuse and neglect, the right to participate in decision-making around transition of care, and the right to manage personal financial affairs. We know this bill will provide a foundation for rights and appeal procedures around the eviction of residents in assisted living facilities and will ensure that the expectation of dignity is uplifted and enforced for residents in this setting too. Thank you.
Thank you. Do I have any questions for this panel? I see no questions. Thank you for your testimony. We have an unfavorable, Dana Kaufman.
Thank you very much, Chair Beidle, Chair Klossmeyer, members of the committee. For the record, my name is Dana Kaufman. I'm here on behalf of Lifespan Network. And we do have concerns with this bill. It's really more focused on the intersection between the Office of Healthcare Quality and the rights or the authority that is granted in this bill. And I do want to be very clear that these are not new rights. The rights are already articulated in the law for nursing homes, and the rights that have been put into this bill for assisted living is already enforceable rights. If you take a look at my testimony, you will see the cross-reference that is in the COMAR regulations. Those COMAR regulations depict each of those rights that are in this bill, making them enforceable rights right now by the Office of Healthcare Quality. If there is an issue within the Office of Healthcare Quality and the enforceability of those rights, then I think we need to also address that issue. Our concern is, and I just want you to understand, like I said, those are enforceable rights, and the Office of Healthcare Quality has the authority to come in right now when they believe, either through a complaint or an inspection, that residents are in immediate jeopardy. And if a resident, and if there's a determination, then they have to have a plan of correction and immediately cease that behavior, which is very similar to the injunctive relief. I also want to point out that they have wide authority as far as mandating a state monitor, mandating staffing patterns. They can restrict admissions, and they can also suspend that license and revoke that license. So they have very broad authority. So what we're trying to do, and I have reached out to the Office of Health, to the Attorney General's office to have a discussion, is to make sure that this is not duplicative and to understand what OHCQ has and how it's differing from what is being asked for in this bill. We think that is very important. So thank you.
Thank you. Do I have any questions for Ms. Kaufman? Senator Kramer?
Thank you, Madam Chair. Hi there, Dana. How are you today?
I'm hopefully fine.
Good. Hopefully so. And hope springs eternal. Dana, trying to understand the concern that Lifespan is expressing, and would you share with the committee, please, exactly what Lifespan is?
So Lifespan is a senior care provider association. We represent really the continuum of care. So we have not only nursing homes, we have assisted living programs, CCRCs, home care, hospice, and then the ancillary providers that also bring in those services like rehabilitation.
So basically, it's your members that would be perhaps affected by the requirements of this legislation that would permit the Attorney General's office to come in and try to protect the residents of the facilities that are the members of your organization.
Yes.
And you're indicating that your concern is that it might be duplicative of what the Office of Healthcare Quality is doing, and share with me why that would be problematic. If we have another state agency looking to protect the vulnerable residents that are residing in your members' facilities, why wouldn't that be a good thing?
Our concern is basically trying to understand, and first of all, I should say that our members have always taken a very strong stance for enforcement and making sure that the Office of Healthcare Quality has the resources that it needs for enforcement. We have come in and supported other bills.
And that's laudable.
And that has increased that enforcement. So I think that's the first step to know. The second step is to try to figure out that relationship between the Office of Healthcare Quality and the injunctive relief. Again, as I have said before, if the Office of Healthcare Quality comes in on a complaint inspection, they are supposed to be following certain timeframes. I think it's 10 days for a complaint that they must come in for. So if they come in and they see a violation of an enforceable right or quality standards, it immediately has to stop through a plan of correction.
Well,
So-
let me ask you this, and I apologize. I don't want to get too deep into, looking at other aspects beyond my line of questioning. Does the Office of Healthcare Quality have injunctive relief as an option when they discover there is a problem and a violation within a nursing home?
So my understanding of injunctive relief is to require that that action, that is the underlying complaint, cease.
And is it specified currently in either COMAR or in statute that they have the ability to seek injunctive relief?
The words injunctive relief, because that is a legal term from the courts, is
Okay.
not specified in COMAR.
So the
Or-
answer then, just so we're clear, the answer is no.
The
And you-
answer would be no, but the
Okay.
underlying action that has to stop would be yes.
Okay, but the answer to my question with regard to what it is the Attorney General is seeking in this legislation and what currently exists, the answer is no.
Injunctive relief is
So-
only allowed by a court.
And injunctive relief, that would simply afford the Attorney General the opportunity to come in, and if they see a repeated pattern of some kind of abuse or neglect, injunctive relief would mean they could go in and to the court and say, stop this action. Is that correct?
Correct, but in the meantime, the Office of Healthcare Quality has that authority to require that action be ceased.
Understood. And now we're looking at, maybe here's a second agency with a second set of eyes and perhaps the staff to actually ensure protections for our most vulnerable. Is it the Office of Healthcare Quality that is responsible for nursing home inspections in the state?
Yes,
And so perhaps you were here just shortly ago to hear about the failure of the Office of Healthcare Quality to be doing those inspections. Despite the fact they have the authority, they're failing to do that. Were you here for that conversation?
I was here, yes.
So what you're representing to this committee is the same entity that is failing right now to protect our most vulnerable just with a simple inspection is who you're pointing to as the entity or agency that we want to have continued doing the things that you said could be done, that you're afraid are duplicative if this bill were passed. Would that be correct? The same agency that's not accomplishing now is who you want to keep pointing to as the source for accomplishing those things that the Attorney General's office is saying, let us help.
I am pointing to the fact that the Office of Healthcare Quality has the authority. If the General Assembly doesn't believe that that authority is being exercised appropriately, then I think that that is an issue that should be addressed as well.
And I think part of addressing that issue, with all due respect, is the bill that is before us with the Attorney General stepping in and saying, let me help, let the authority and the power of our office step in to ensure and help protect these most vulnerable. So I think that's exactly what the Attorney General is doing under this bill. So thank you, Dan. I appreciate that, Madam Chair. Thank you.
Thank you, Senator. I see no further questions for this witness. Thank you. And we have one virtual witness, Stevan Ellis. Good
Hi.
afternoon.
Hi, thank you very much. My name is Stevan Ellis. I'm the State Long-Term Care Ombudsman. I'd like to thank the chair, the vice chair, the members of the committee, and a special thanks to the Attorney General and Mr. Shirley for providing testimony on this bill. I'm asking for this bill to have a favorable report with a couple of amendments, adding resident dumping and abandonment. As the director of the state ombudsman program, we find that many assisted living residents are unaware of their rights. The long-term care ombudsman program is the advocacy program for assisted living and nursing home residents. And by the way, our names are posted in the facility as well as the Office of Healthcare Quality to address a question that was brought up earlier. The long-term care ombudsman program has seen too many cases where residents were not treated with dignity, suffered abuse and exploitation, were trafficked for benefits, were not involved in decision-making, and were discharged inappropriately. When these rights are violated, it can often lead to very serious, devastating, and often life-threatening situations. We really do appreciate the Attorney General's office asking for this bill and asking for injunctive relief, because this is about very serious issues, not just regulatory issues, criminal acts. I'm asking for amendments for abandonment and poor discharge planning, meaning resident dumping, because these things the threat of them can cause emotional and physical distress, but when they happen, they cause harm. And in cases where residents are abandoned, you have my testimony for some specific examples, but this is when residents are left unattended and alone for hours, when facilities relinquish their licenses and says, we're not going to take care of facilities anymore, and become unlicensed facilities, and when residents are discharged inappropriately, as some of the examples that Christine Moore from Legal Aid mentioned. I want to emphasize that there are currently very few protections in the state regulations and law for both of these issues and for assisted living residents in general. This bill is incredibly important because it will strengthen the current assisted living law, which exists to protect residents and to ensure the quality of life and quality of care for residents. I'm asking for a favorable review of this bill with my amendments. Thank you so much. I really appreciate your time today.
Thank you, Stevan. Do I have any questions for this witness? I see no questions. Thank you. That ends the hearing for that bill, and we're now going to go to Senate Bill 751, Senator Klausmeier.
You just have your. Yeah, but he was on. Yeah, just tell John to come like this.
Senator, are you bringing up your panel?
I have part of them.
I have Ann Seacott, Tony Torsch, and John Torsch as your panel.
Yeah, there it comes.
Okay.
Okay, this is the first panel, and the second, their panel too. Thank you, Chair Bidle and fellow members of the Senate Finance Committee for the opportunity to present Senate Bill 751. As this committee may remember, in 2019, the Maryland General Assembly created the Opioid Restitution Fund to receive all funds awarded to the state of Maryland through legal settlements with prescription opioid manufacturers and distributors. Senate Bill 751 will make some changes to this statute to increase transparency and ensure that community-based recovery organizations get the support they need. First, the bill makes two technical changes to reflect Governor Moore's renaming of the Maryland Office of the Overdose Response. Second, the bill seeks to increase transparency regarding the recommendations from the Advisory Council on how these funds should be spent. Under current law, the Advisory Council makes recommendations to the Secretary, but there is no mechanism for reporting back what decisions are made. While we are confident that the current Secretary will be reporting back to the Advisory Council, we would like to ensure this will take place in a timely manner, no matter who is the Secretary or the Governor. We are also asking that the information be posted on the department's website. Third, Senate Bill 751 would require that at least 25% of the funds be used to support community-based recovery organizations. I've shared an amendment with the committee that defines a community-based recovery organization as a nonprofit organization that is founded and led by members of the state or local substance abuse recovery community and provide non-clinical substance use recovery support services at no cost to the participant. These organizations provide a variety of essential services, including case management, care coordination, peer support, funding for housing, naloxone training, and much more. Finally, this bill would require local governments that receive funding directly from the national settlement agreements to report how they are spending their funds. While we understand there is a reporting requirement under the National Settlement Agreement, we believe that it's prudent to put in state statute that the county and municipal governments must meet the same standards of transparency as the state government. I thank you and I ask for a favorable report on Senate Bill 751 with my clarifying sponsor amendments. And I know there's some opposition to this bill after reading and a couple of the different letters. And I think at this point we'll go on with the bill, but if there's work that needs to be done, I'm ready to work on the bill. So thank you.
Good afternoon, Madam Chair, members of the committee. I'm Ann Seacott testifying today on behalf of the Maryland chapter of the National Council on Alcoholism and Drug Dependence. NCADD Maryland participates in a national coalition that looks at how states and local governments are spending opioid settlement dollars. In some other states, we are learning of things that we believe the monies are being misused for, things like filling potholes and paying off government debt. We have not heard of these misuses in Maryland. We think credit goes to the forethought put into the creation of the Opioid Restitution Fund, as the sponsor mentioned. What Senate Bill 751 proposes in part is to add a level of transparency on the spending of these settlement dollars. We do understand that there is some reporting requirements already in the various settlements. We are not looking for additional or different information. We just want to make sure that all that information is publicly available. And if the department is already receiving that information, we certainly want to, we'd love to see it posted on the website. The creation of the advisory council to the Opioid Restitution Fund was intended to provide a level of transparency and community input into how money is spent. The advisory council has made its recommendations. They did so back in, I believe, November. And the secretary and the governor have those recommendations and they are still making decisions. We just, again, want to add some time frame as to the response. And then finally, we are seeking to direct at least 25% of the funds to support the community-based recovery organizations that again are defined in the sponsor's amendment. These organizations are nonprofits that are local. They are provide the essential supports that help people maintain recovery, and they are non-clinical services. We've seen a continued increase in overdose deaths, and we must continue to invest in treatment, peer support, prevention, harm reduction, and recovery support services. So we ask for a favorable report.
Thank you again. Tony or John?
Oh, you go ahead first, Paul.
Good afternoon. I'm Madam Chair and Senator Klossmeyer. Thank you for sponsoring the bill and committee members. I'm Toni Torsch. I'm the director of the Daniel Carl Torsch Foundation. I'm also a mother who lost her son due to an opioid overdose. This bill it is asking for full transparency, and I think we can all agree that I think all of your constituents deserve. It's also asking, of course, for a percentage of the fund to support recovery community-based organizations. You have the definition of what we consider an RCO. So a lot of credit goes to your committee because Maryland is doing really pretty well with a lot of the laws that you've already passed. We have a lot of detox services and treatment services. We have on-demand treatment, things that were not there when I was searching for help for my own son. But where we really have the need now is recovery support services. And the needs are great. It's taking longer to gain stability and it's costly. We can't afford to wait another year to see how this fund goes, how it works out. We can't afford to wait another month. And due to the last administration, some of our trust has been tainted because of some failed promises. I think you all remember the debacle of the Optum Health. And what we experienced out in the community was the people that really suffered the most were the recovery programs and the people in their clients. I see I'm running out of time. I'm sorry. I just want you to remember of how we gained those funds. It came because of the deaths and the destruction within our communities, within all of your communities. We do have other opportunities, small CBOs. We do have other opportunities for grants, but everyone that is a nonprofit, we're all vying for those same funds. So I'm vying for the same funds that Shepherd Pratt or Johns Hopkins is vying for. And we have no thread of funding for recovery support. With that, I just want to respectfully ask for a favorable report.
Good afternoon, Chair Pina and Chair Beal and the rest of the committee, Finance Committee. My name is John Torch. I'm the co-founder and the program director of the Daniel Carl Torch Foundation. I'm also a person in long-term recovery from drug addiction, and I'm a former peer recovery specialist and care coordinator who actually was boots on the ground providing these recovery support services. I lost my first friend to a drug overdose of Oxycontin when I was 16. His name was Iggy. He went to Perry Hall High, and he was a junior when I was a sophomore. So, this crisis has started to affect me since I was a teenager, well before I lost my brother Dan to a heroin overdose, literally in my arms as I tried to save him. The transparency is so important part of this bill because, as we've seen historically, that even though the mandates are there, it doesn't always happen the way it's supposed to. We've seen in other states how some of these funds are squandered, and we want to just be sure that it doesn't happen here. Again, it's nothing personal. It's not against one particular agency or any one particular person. It's just to be sure that, these little CBOs, we're the little people, all right? We're the boots on the ground with lived experience. We don't provide billable services. Anyone that would qualify for these funds are the exact people that these funds were meant to benefit. And recovery support services are so incredibly vital to the recovery process. You're talking about bus passes and birth certificates and IDs, helping people with their resumes, paying for recovery housing, transporting people to their doctor's appointments, to social services, to MVA. That's what our peers do. That's what recovery, and when we take case management, that's what it actually means. The housing, the scholarships that we give people a month and 2 months. You can imagine what 2 months in a safe, hospitable and recovery conducive environment can do for someone who spent the last sometimes years of their life in survival mode every day. So with that said, we ask for a favorable vote. Thank you.
Thank you. Do I have any questions for this panel? Oh, Senator Gao.
And thank you, Madam Chair, and thank you, Madam Vice Chair, for this bill. I serve on the Opioid Restitution Fund Advisory Council, and so I appreciate you bringing this. I know you touched upon some of the opposition, and I think what I can tell, it's mostly just from like counties, and I do understand their concerns. But what my question though is in looking at the other testimony that was provided, there's a letter from MDH, and I know that you also submitted amendments. Does the amendment that you submitted, does that reflect the requested amendments by MDH and Secretary Keller?
So on the amendment, so the sponsor's amendment, we actually picked up right after the bill was introduced, that we neglected to put in the definition. So I think there were a lot of people who had concerns that we didn't define the recovery organizations. So that was part of it. We are in negotiation with both the department and MACO. I know the department has concerns about the timeframes with which they need to respond. We're happy to be very reasonable about how much time that takes. The reports that are coming in, I've had some discussions also with Mako. Those reports seem to be, coming to the department. So we just need to make sure that whatever that information is made publicly available, so that folks can see how their local governments are spending the money. So if that needs to change in the bill, I think we're willing to do that. And then I think the most difficult piece, though, is the 25% set aside. And so, as advocates and providers are looking for 25%, the department wants 0. So maybe we're hoping maybe there's something in between.
Okay. Okay. So discussions are ongoing, basically.
Yes,
All
yes,
right.
we are
Thank
working
you.
on it.
All right. Thank you. Thank you, Madam Chair.
Thank you. I see no other questions for this panel.
Thank you.
Thank you.
Senator, I think you have 8 people on your next panel, so I'm going to call up 4,
Okay.
or maybe,
However you
maybe
wanna
it's,
do it,
so, I don't know. I don't want one person or 2 people being stuck by themselves, so. Aaron Wright, Clayton Appleby, Chris Rivers, and Lisa Lowe. Let's try those 4. Let's see if we've got 4.
You first, Madam Chair. Thank you, Madam Chair, and thank you, Madam Vice Chair, for sponsoring this bill, and thank you, Finance Committee members. My name is Aaron Wright. I am the General Program Operations Manager. I wear like several hats in my organization called Voices of Hope, where we help individuals find and maintain recovery. The person you see speaking right now was not the person 10 years ago. I was a heroin addict for 23 years. I had an 18% chance of seeing the age of 30. And thanks to the God in my understanding, I'm 52 years old and a father of 4, married with a home here in Cecil County. I'm not alone. According to SAMHSA, there are 20.9 million people in the United States identified as recovery in 2021. If you were to break that down by state, let's say 400,000 people in the state of Maryland in recovery, 400,000 constituents. Now, I have to take my daily medicine just like those other 400,000 people, right? I have to go to meetings. And what the Recovery Community Organization does is it speaks for, advocates for, customizes, and caters to the individual needs of that community. It taught me how to be a dad, how to be a productive member of society, how to pay my taxes, and how not to get arrested. 400,000 people need this help, and we need recovery community organizations to speak for those individuals' needs. So when it comes to SB 171, is that correct? 751. 751, excuse me. I implore a favorable report. Thank you for my time.
Thank you. Who's next?
Good afternoon, Madam Chair, and thank you, everyone in the Finance Committee. That's a hard act to follow. My name is Chris Reeves. I'm a brand new employee at Voices of Hope. I've been an employee of Voice of Hope for now 8 months. I met the executive director at a meeting about 1.5 years ago, and she told me about how they do harm reduction, how they get into the streets and save lives, and how they're a peer-centered program that has people with lived experience helping people that need to get into recovery. I thought it was amazing what they do. I lost my daughter to an overdose 12 years ago, and they basically lured me away from corporate America, and I took a large pay cut to work for this organization, and I love every second of it. I get to help people every day. I kind of get to keep Caitlin alive, is the way I look at it. Voice of Hope is an outstanding organization. Same with the Torch Foundation, ACR, Rage Against Addiction. And I'm only talking about the ones in Hartford and Cecil County that I know of. I've only been doing this for 8 months, but I absolutely love it. My title is Program Advocate. So I advocate for the nonprofit. I advocate to government officials. I advocate to moms and dads, business owners, and I try to get people to understand what we do, how we do it, why we do it. It's pretty simple. The transparency of this bill is very important. I think we all agree. And that 25% would be a godsend for the recovery community organizations to not all have to fight for that grant money. Because like Tony said, we're all fighting for the same grant money, and there's just not enough out there. Thank you for your time.
Thank you. Clayton, you're next.
Yeah, just to follow up with what they're saying, my name's Clayton Appleby. First of all, thank you, Madam Chair, and thank you, committee. I really appreciate being able to address you guys right now. So I'm also a person in long-term recovery from substance abuse disorder. In 2015, I went into treatment after years of dealing with an opioid addiction, which was something that directly impacted my friends, family members, like my entire community pretty much, and it was directly a result of what was going on at that time with the opioid epidemic. So for the past couple years, I have had the opportunity to work for Addiction Connections Resource, a nonprofit in Harford County, alongside with Voices of Hope and the Torch Foundation. We all kind of do the same things. And I work as a certified peer recovery coach. So I'm like on the front lines with people coming out of treatment. We do a lot of funding for people going into sober living and treatment scholarships, but really like the journey begins after, the treatment is over. When people are in the sober livings, that's really when the journey starts. So it's really essential that organizations like mine and other nonprofits are able to function. So that's why I'm favorable to this bill and advocating for it right now. And yeah, I would just like to say, when I got sober, it was in 2015, like I was saying, and these kinds of organizations weren't as prevalent. I was in my early 20s, as were most of my friends, and we all kind of did it the hard way without this kind of support. So I really set myself back a couple years. I've lost a lot of friends that I know would have directly benefited from the kind of services that we provide. So yeah, I thank you guys for letting me speak.
Thank you. Finally, Lisa.
Lisa Lowe, Face Addiction Maryland, and I'm here to support the promise that this bill potentially holds out for community-based organizations. And if I went around the room and asked you what a community-based recovery organization is, I don't know if anyone would know. So I wanted to tell you some of my concepts. Addictions Connections Resource in Harford County, Linda Williams founded that in 2000, and she created the first safe station in Maryland inside her home with no money, a full 17 years before Anne Arundel. Safe stations would be funded with a grant in 2017. And I navigated over 200 Marylanders into some level of treatment with my affiliates in Montgomery County with no funding source whatsoever, a full 6 years before Montgomery County funded their STEER program that cost nearly $240,000 to navigate 44 to 101 people per year into treatment between 2017 and 19. Or it's, any of the 6 nonprofits that formed a network throughout Maryland back in 2014, and we assisted close to 1,400 families with telephone and in-person support. That was the same year that Maryland Coalition of Families was handed $350,000 without an RFP or any bid process to help 100 families. What's really amazing, though, is the 400 recovery residents across the state of Maryland that have popped up across Maryland, when in 2010, the Department of Health focused solely on buprenorphine and methadone expansion, while deliberately excluding ASAM level 3.1 residential treatment. Obviously, people with lived experience still feel that they need this level of care to get better and achieve wellness. Can I finish? Okay. So last year, I contacted researchers and scientists across the nation who had done research on alternatives for opioid treatment. And we had a whole conference center that was not charging us money until 2 weeks, didn't even charge us deposit. In the end, I couldn't find anybody to pro bono do the online planning or the online registration. So instead of funding good programs founded and operated by peers to save lives, what we allow is business operators to chase funding opportunities to make money once it comes down.
You need to wrap up. That was a lot more than a sentence.
That wasn't that long run-on sentence. I used to be an English teacher. I used to grade a lot longer sentences than that. But thank you. Thank you so much.
Do I have any questions for this panel? I don't see any. Thank you. Next, I'm going to call up Deborah Santini, Michael Foley, and Hannah Jones. Yes. Are you Deborah or Hannah?
I'm Hannah.
Will you start, please?
Oh, sure. Just trying to make him go first. Hi, I'm Hannah. I'm here both personally and professionally. I am the supervisor and care coordinator at the Torch Foundation, and I am someone who had their own journey getting here, you know, going through homelessness, prison, group homes, various institutes, you name it. And what Maryland is not lacking in is treatment. We have a treatment center on every corner. What we are lacking in is sustainability, and that sustainability comes from community-based organizations. Oftentimes, we forget how fragile people are when they enter recovery and how overwhelming those simple tasks are, such as obtaining vital documents, lacking in funds to get hygiene, clothing, housing. And as a community-based organization, we're able to meet people where they are and take that burden. And that's where that sustainability comes in. People often, I think, just get overwhelmed by those day-to-day tasks. We focus solely on getting people sober and getting them in treatment. And it's what happens after that. How do we maintain that? And that is through organizations like the Torch Foundation, Voices of Hope. I can speak to our numbers, and I can imagine Voices are far above that as they're much bigger. As a 5-person team, we served close to 10,000 people last year. That should blow every one of your minds. So that is all I have. Thank you.
Michael?
Right. Thank you, Madam Chair, and thank you to the committee for allowing us to speak on this bill today. So I come today as a therapist, mental health therapist, as the owner of a sober living program, as an individual that has worked as the clinical director of a very large program in the Baltimore area. So I have seen how treatment organizations operate, how hospitals operate. I have, played a small role in serving thousands of individuals that were in the treatment system in Maryland. And there are peer support services that exist in hospitals and treatment centers, and in these small community-based organizations. And what I can say based on my experience is that these small community-based recovery organizations are the ones that truly help these individuals the most and that follow somebody throughout their journey. They will, if somebody is discharged from a large organization, oftentimes they are lost. They are not followed up with. These organizations will follow somebody through their journey, whether they fall back into old patterns, whether they are incarcerated. They will follow them and continue to help them and provide them with the resources that they need. And on a personal level, I can also share that I personally benefited from a small recovery-based organization as an individual that was homeless and addicted to substances 12 years ago. And I would not be where I'm at today without the help of that small organization. So thank you.
Thank you, Michael. Do I have any questions for this panel? I see no questions. Thank you for your testimony. Marie Grant is here, I think, from the Health Department, favorable with amendment.
Thank you, Madam Chair, Madam Vice Chair, committee members, Marie Grant on behalf of the Maryland Department of Health. Let me first say I just really appreciate the testimony of everyone who came here today in support of this legislation and these services. The department is support with amendments on this bill. I see the bill, as you've heard already, in two components. One is the transparency component and one is the allocation of the funding towards recovery services. So on the transparency, we are committed to transparency in the award of this funding, but it is the timeline in the bill that we're talking to the sponsor about, as well as the sponsor in the House. It's quite a process. The Opioid Restitution Fund Advisory Council did great work over the course of last year into the fall, and the department is taking that work and report and butting it up against a needs assessment and the data that we are seeing to make sure that the recommendations and uses of the spending that we have for this fiscal year really align with that and get us off on a good foot going forward. This will be the first award. So it's exciting and it's a process, and we would really like the grace. It's also probably taking us a little longer than it might in future years because it is new to everyone. The second piece of the bill is the allocation and the addition of recovery services to the uses of the fund. We are not opposed to the addition of the use of these services to the uses of the fund, and we're supportive of the definition that I believe was referenced. What we are concerned about is the allocation, putting that in statute, particularly at this point. And that's because there are multiple settlement agreements. We want to make sure that we are using the funds again in line with those recommendations in the needs assessment. This is also a changing legal landscape. We just got 4 new settlements this week, which is great, but they all come with their own settlement agreements. And so I'll pause there because I'm over time, but happy to answer any questions.
Senator Klossmeyer.
Hi, thanks, Marie. Thanks. I guess one thought is, and one question is, the 25% that we ask for, okay, that is allocated to the counties, or that's just the random number, but the counties, are they doing their own thing? And if so, is there one person that are in charge of all the different counties and know what's going on in the counties? Because we need to know that information.
Yeah. So I think my friends at Mako may be able to answer that better. The counties do get their allocations that flows back directly. They do report up to us or to the Office of Opioid Response on how they are spending that money. I think we're very open to transparency and just making sure we're not making it extra burdensome. I'll think you'll hear from the counties on that, but certainly figuring out how we can get that all in one place. The 25% I referenced is in the bill, and it talks about the 25% of the overall fund for services. And that's what we're concerned about just because of the overall legal landscape.
Okay. And what it always comes down to the grants that these folks are doing. Is there ever a mechanism through the health department that they can get like a streamline of money to keep them afloat? Because that's part of this whole deal here, how we can help people.
Yeah, absolutely. So Senator, I think that's a great question. I know that's the overall goal for this program. So first of all, I just want to say that recovery is very clearly on our vision for overall behavioral health in terms of what we see as the continuum of care in that areas where we support. And I know that we've heard from recovery providers that they are not getting the types of funding that others are. And so that's something we're taking a close look at.
Because a couple of years ago, as Tony Torch said, she applied for one of the grants, but the big places, the hospitals and everybody got them. And these are the boots on the ground, and we all know that. And they work extremely hard. And so we have to figure this out. I mean, we figured a lot of things out about the opioid crisis, what we can do to help people if they have ODs and all that kind of stuff. But I think we have to take the next step and continue going.
Yeah. And we definitely agree, Senator. I think it's just the language to get us there.
Yes, and we'll talk next week.
Okay, sounds good. Thank you.
Marie, thank you. And I know you'll work with the senator and we'll get it right.
Yep.
Thank you.
Absolutely. Thanks, Madam Chair.
Before I call the one unfavorable, I want to thank everyone that testified today for telling your stories and congratulate all of you for being in recovery. I know it's not easy, but it was really good to hear your stories today. Sarah's sample is our unfavorable.
Thank you to the chair. Thank you, members of the committee, for having me today. My name is Sarah Sample. I'm here on behalf of the Maryland Association of Counties. And I too want to thank everyone who's come here to testify today on this really serious and important issue. From a county perspective and why we're in opposition, like, we understand that remediating the opioid crisis is something that takes a great deal of urgency. And at the local level, it takes a ton of collaboration across our divisions. We also have to collaborate directly with the state. So it's a very big lift. There's a lot of collaboration and coordination. It's absolutely something that demands urgency, but we also think demands reporting, transparency, and accountability. There's no question about that. We do feel as though the current standards in terms of our reporting are sufficient. And I can go through what that looks like a little bit so we have a good understanding of it. So we've got the National Settlement Agreement that defines some of those reporting requirements, the state subdivision agreement that also adds a layer there. And then we have the local abatement plans that all the counties have to go ahead and submit to MDH. And then when it comes to the multiple pots of money, the grant funding, the applications are incredibly extensive. So we do have to submit a lot of information on the front end with those. And if we were granted any funds, the reporting requirements for those are also pretty extensive. And then the last thing I would add is that Section 6 of the subdivision agreement says that we are required to be audited by the state every year for every dollar. And that doesn't matter which pool of money it comes from. It could be the allocation from the settlement. It could be a disbursement, a discretionary one from the state. It could also be grant funding. But so we have to report to the state every year on exactly how we're spending all of those dollars, no matter how they came to us. And we're just concerned that we're going to get into a situation where if we keep adding these layers of reporting, we're doing more reporting than actual remediation work. And there's a lot of urgency, as I've already mentioned. The last thing I would say is that we don't think it's appropriate to be earmarking a portion of the competitive grant fund for separate organizations because it is a competitive grant fund for that reason. And we think that their application should have to be vetted against the rest of the group and stand up to that quality. And what I would also add is that we have a lot of small counties that are also not like Shepherd Pratt or Johns Hopkins that don't have grant writers that are also competing for those competitive grant funds. But so for those reasons, we would urge unfavorable.
I guess, thanks, Sarah. The thing that, because Baltimore County, Baltimore City, and the surrounding counties have the big hospitals, that's what the community-based organizations are up against. And I would venture to say they may not have grant writers either. Maybe they do. Mm-hmm. But it takes a long time. I know Tony's been working for years and years to get her organization where it is at this point. So that's my biggest concern, that when the big hospitals come in and just say, hey, we need the money, they have the most clout, I would think. And that's what has happened over the years. So, and I'm just looking out for the little guys. And these are the ones with the boots on the ground. So, and I get what you're saying. So I hope we can come to some conclusion and just try to work on that in the next week or so.
Absolutely. Yeah. And we're working with the stakeholders. We've been in conversations with everyone. And the other thing I would add, I do think that some of those local governments, they're comparable to some of those smaller organizations, not Baltimore counties and Baltimore cities. No, I'm thinking Caroline and Wacomico and some of those smaller places. And then when it comes to boots on the ground, I've been tracking what we've been doing with our opioid money that we've got now pretty closely. I've got a spreadsheet here that's tons of different things. I could read through it, but I don't want to waste your time. I can email it to you. But we've got boots on the ground too. And we certainly want to be able to collaborate with as many people as possible to make sure that we can remediate effectively.
Okay. Thank you.
Thank you, Sarah. That ends the bill hearing on Senate Bill 751. Next, we have Senator Kelly here, and she's going to do Senate Bill 875, the Miriam Kelty Aging and Senior Social Connection Hub. Senator, do you have a panel to bring up?
Yes, ma'am. They're on their way.
Thank you.
I will give them a moment to get seated. We have enough chairs up here for the whole panel. as they get themselves settled, I will just introduce the title of the bill, which is Senate Bill 875, the Miriam Kelty Aging and Senior Social Connection Hub and Spoke Pilot Program. Make sure everybody is seated. Thank you. And before I talk too much about this bill, I just do want to point out in the audience a woman by the name of Mary Jo Deering, who is a dear friend, and she's actually a real champion in this space. And we wanted to be considerate of your time, so we only have this many people on the panel. But I do want you to take a look at her written testimony because she can explain also why this bill is so important. And I'm glad she's here today. This is actually my favorite bill of the year, so I'm really happy to be sharing it with the Finance Committee today because I know that you share my passion for supporting our seniors. And so I'm confident you're going to appreciate this bill as well. It doesn't have any opposition. It is supported by the Department of Aging, who's represented here today, as well as Leading Age Maryland and the Health Facilities Association of Maryland and a number of other stakeholders who work with our aging population. If you're not familiar with the Village movement, it is a volunteer-led movement that supports seniors as they age in place in their communities. Villages help develop multi-generational community relationships, and they ensure seniors have the social connections and supports that they need to age in place through a neighbors helping neighbors model. The bill before you is a 3-year pilot program to help the state learn how we can best support this cost-effective model for helping seniors age in place and also combat loneliness. And what we want to do is really expand this model to lower income communities and provide administrative supports as we grow this model. And particularly around sort of nonprofit infrastructure. There is a friendly amendment to the bill that came from Montgomery County just to clarify what was always the intent of the bill, that the funds from this would be transferred from the Department of Aging to the consortium. So you should have that amendment. You can read in the bill sort of the purpose of the pilot program, and the experts here I think can best explain it to you. I'm just here to introduce them to you and to encourage you, please, to move favorably on this bill. I think this pilot program is going to help us help people and strengthen our communities. So with that, I think I will pass it off to Liz Woodward with the Maryland Department of Aging first, so she can talk to us about how this is going to work for us.
Sure. Thank you very much. So my name's Liz Woodward. I'm the Director of Special Initiatives at the Maryland Department of Aging. I thank you, Chair Beidel, for the opportunity to testify in support of this bill, Senate Bill 875. And I thank you, Senator Kelly, for your leadership here and for working very collaboratively with the Department of Aging. So as you may know, Maryland is getting older and fast. In response to our demographic shifts, the Department of Aging recently had an executive order signed by Governor Moore launching the Longevity Ready Maryland initiative. It's a multi-sector planning effort to help us be more ready as a state for the opportunities and challenges ahead. The goal is for all Marylanders to live lives that are healthy, financially secure, socially connected, and purposeful. The Village model in this pilot aligns perfectly with the state's longevity, readiness, and service goals. Villages promote social connections, they reduce loneliness, they deliver valuable support to older Marylanders who are living in their homes, and that helps to delay the need for more expensive long-term care settings. It saves money. It preserves the home as an asset, which has an impact on the generational wealth gap. This pilot program, which is produced by the nonprofit consortium of villages, aligns with our role at the Department of Aging as a small but impactful agency, planning for longevity, readiness, and the needs of older adults. We're most useful in convening and spreading successful interventions and best practices that benefit older adults in the longevity ecosystem to our area agencies on aging, other institutional and community-based partners, and they implement. And this bill provides a clear, workable outline for the department and for the Village Consortium to do just that. It delivers in 3 short years a valuable report that we can use to further promote additional village growth statewide. For these reasons, I urge a favorable report on Senate Bill 875.
Thank you. Who'd like to go next?
Want me to go next? That's fine. Hi, I'm Connie Rao. I am the president of the consortium, and I'm here on behalf of the 7 members of the consortium to try to explain very briefly what we're about and what this is about. So there are 2 problems with the villages movement in Montgomery County, but also across the state. One is that some of the 30+ villages are not sustainable at this point because they are too small to have money for staff and they run out of volunteers. Others have never been developed in areas of the county especially the lower income and rural areas of the county, where there simply isn't the infrastructure, there isn't the unpaid labor in some cases to be able to put villages together. So what do you do about that? Well, the model that we are adopting in this is an administrative services organization that services multiple of the villages. That's called a hub and spoke model. A report has been done. The model that we are developing is aimed at the problems that we have in Montgomery County. And we think that this bill would be very, very effective because, of course, with the things that we are going to be learning in adopting this approach, we will have lots of things to say about using this approach that may be effective in other parts of the state where there are many, many fewer villages than there are in Montgomery County in relationship to the population, and where the villages model as a volunteer-based organization model is an essential part of what needs to be available for seniors. So I come on behalf of the 7 initial members, and I would be happy to answer any questions later about what this actually is. Thank you.
You want to go next?
Sure. Good afternoon, Madam Chair and Vice Chair and committee members. My name is Elizabeth Carrier. I'm honored to have the opportunity to testify in support of SB 875. I serve on the Montgomery County Commission on Aging, and I'm also speaking on behalf of the commission. I also am a founder and past board chair of a village in Bethesda. From having a long affiliation with a village, I have witnessed how villages provide services and programs that help reduce social isolation and help older adults age in place in their communities. SB 875 can help to sustain existing villages and create new villages by efficiently providing administrative support such as accounting and web services to villages in a hub and spoke model that centralizes and streamlines back office administrative functions. The proposed pilot will efficiently provide these administrative services to villages so they can put their efforts into their core mission of providing services and offering events that help to reduce social isolation and help older adults age in place. In summary, SB 875 will assist in the growth of villages in diverse and lower income communities and will help to ensure the sustainability and efficiency of existing villages. The pilot will make an important contribution to learning, testing, and developing best practices for this innovative model of village management. This innovation can offer insights to villages across Maryland and help the Department of Aging with their mission to make Maryland longevity ready. I urge a favorable report for SB 875 and am pleased to answer any questions. Thank you.
Who's next?
Okay. Thank you. I'm Michael Ware, and I am I serve both as the vice president of the consortium as well as a vice president of Little Falls Village, one of the startup members of the consortium. I'd like to focus my comment today on really the area of resource sharing, if you will, an important area to us all. Many villages are well developed. They have the ability to share resources. Others have very limited capabilities and can benefit from the resources of others. There are areas also without a village at all that can benefit from the outreach to establish a village. The hub and spoke model offers the opportunity to extend support to villages across the spectrum, supporting well-developed villages and allowing them to share resources, expanding those with limited capabilities, and providing outreach to areas with no villages at this time. The village that I'm a part of, Little Falls Village, located in Bethesda, is a good example, I think, of how one village can help others. Little Falls Village is a very well-developed village at this time with multiple programs and support activities. We are, in fact, the fiscal sponsor for the consortium, helping the consortium to begin its work. We also currently share programs and events with other villages and plan to extend this approach as well as and use our expertise to help the villages within the consortium and elsewhere. We do anticipate that other villages will also be doing this type of resource sharing. We think that establishing the pilot program is an excellent investment in helping Maryland seniors to maintain and improve their quality of life. And thank you for the opportunity to be here and to visit with you today. Thanks.
Thank you. And we have one more person.
No, you're fine. It's on. Yeah.
Can you hear me well? Well, thank you for giving me the chance to give you this testimony. I wanted to put things in context and ask you why. Why are we here? Why is this important? And it's something that I've been giving a lot of thought to. My name is Pazit Aviv. I work with Montgomery County Aging and Disability Services, and I've helped about 20 villages start up. And I've spoken to people all over the county, up county, down county, east and west. And what I've heard is, and I think that it will be echoed else in the state, which is why we think it's important, is that our communities are falling apart. People have not invested intentionally in building a relationship locally. We've all been so busy doing other things in our lives so that when we retire, we find ourselves rather isolated and disconnected. And this is not a frivolous matter. It's not a matter of like, do I have someone to play bridge with? This is at the core of what it takes to age at home with high quality of life. So villages is providing this foundational need, which is community. It's not necessarily about service A or event B. It's about helping people reweave those local social fabric of connections. And villages have done well for each other in the local neighborhoods, but we have been thinking about equity. And what does it mean for you to be in an established village in one neighborhood, but seeing other parts of the county not getting the benefit of such an incredible resource? And so villages are forming together, banding so that they can support each other and reach out to communities who do not have the infrastructure necessary to build their own villages. And I think that's the crux of it, because we are thinking about communities, and I've worked with lots of parts of the east part of the county or the upper part of the county where they do not have the necessary local leadership to do that. But if you provide what I call the back office function, it is so much easier to then engage leaders, find volunteers, and begin doing the work. So in short, it's not just about the what, it's about the why. Thank you.
Thank you. Are you Pazit Aviv? Is that your-
Aziz, yes.
Thank you. Thank you. I didn't hear your name at the beginning. Do I have any questions for Senator Kelly or this panel? There is an amendment. I guess you've submitted, Senator Kelly, and we'll certainly add that.
Yes, that's a friendly amendment. Thank you so much.
Thank you. All right, seeing no other questions, that ends the hearing on Senate Bill 875. Thank you all for your work.
Thank you all. Happy Friday, everyone.
We have Senator Carter and Senate Bill 896, the Baltimore Convention and Tourism Redevelopment and Operating Authority Task Force. She's in the lobby. Wait a minute. Thank you, Lisa. We have everybody but the senator. Okay, Senator Carter. And this is your panel?
Yes, Madam Chair.
Thank you.
It's a long day, colleagues, so I promise to be brief, and I'm sure my panel will be brief too. This is a great bill that I think everyone would get behind because we know how critically important it is as Baltimore being the hub of Maryland, and the fact that we need to do everything we can to attract greater tourism. And so this bill is simply a bill that creates a task force for the Baltimore Convention Center and Tourism Redevelopment Operating Authority task. It's a task force for the Baltimore Convention Center and Tourism Redevelopment. And I will just note that there are a couple of amendments. It's my understanding that we have some here, just adding members, and also the House has added a member to make sure that the task force reflects the cultural diversity of the city. So we want to make sure that we're inclusive, and that's my testimony. I'm going to let the others take it over. So
I'll try to match, I mean. Good afternoon, Madam Chair, members of the committee, Justin Williams, Deputy Mayor for Community and Economic Development. Just to add on what Senator Carter mentioned, this will be creating a task force that will inform the creation of a convention center operating authority. As I'm sure many of you are aware, Baltimore's on the cusp of a renaissance with the success of the Orioles and Ravens, highlighting the vibrancy of the city. The homes of the two teams are poised to receive $1.2 billion of investment. That's in addition to the $6.5 billion going around the downtown area. The convention center is the hole in the donut, though, of missing investment. It's been a 45-year-old facility that has last been renovated in 1996, and it needs some nice love and care. And the issue is right now with the ownership or operation of the convention center being city department, the incentives aren't really aligned because it's just a city building that needs city investment. And obviously the resources are tapped and the benefits to tourism and conventions flow to the region and the state. And so that's the vision for needing an authority that will take over the operation. So we ask that you support this bill favorably with the amendments. Thank you.
Who'd like to go next?
Okay. Good afternoon, Madam Chair, Madam Vice Chair, members of the Finance Committee. I'll speak loudly. My name is Matt Campbell. I'm the Executive Director of the Baltimore Convention Center. With the limited time we have this afternoon for testimony, I wanted to take this opportunity to encourage you to read my written testimony should you want some background on how the BCC operates currently and some of the current challenges it has. That'll allow me to use this time to more focus on the direct reason for this task force and why we're requesting this legislation. It goes without saying that the Baltimore Convention Center is a catalyst for economic activity throughout the city and state. If you ask stakeholders from hotels and restaurants, attractions and retail, the impact of citywide conventions is clear. The sales tax received by the state and the hotel and income tax received by the city allow government to spread the financial benefits of our work to every corner of the state, even though most citizens don't ever really realize that. Much like Shel Silverstein's Giving Tree, however, the Convention Center has given its all for the benefit of others over the past 45 years and has been left in a shell of its former self. It can no longer provide the expected 4-to-1 return on investment as we constantly fight to keep catastrophic system failures from impacting business. Not to mention that lead generation has dramatically shrunk due to the fact that we're an older, less competitive facility. We must think differently if we are to compete. This legislation assembles experts in conventions, transportation, tourism, finance, and urban development, along with voices from the local business and residential communities, charging them to dig deep into the data and return to this body in December with thoughtful, collaborative, and strategic recommendations on how the BCC can play a vital role in Baltimore's renaissance and Maryland's continued prosperity. This legislation requires all of us to make the time and make it clear that it's a priority of both the city and state to get it right and to do it now. Unfortunately, our building cannot wait any longer. We're on borrowed time. I'm more than happy to speak to any questions you may have and implore you to vote favorably on SB 896. Thank you.
Thank you. Amy, you want to go next?
Good afternoon, Madam Chair, members of the committee. My name is Amy Rohrer, here on behalf of the Maryland Hotel Lodging Association in support of SB 896. Baltimore City is a key market for Maryland's lodging industry. When the city hotels do well, it helps to lift the entire state in terms of hotel performance and its contributions to Maryland's economy. In Baltimore City, we have 34 member hotels representing 76% of the total rooms in the city. 11 of our Baltimore City hotel member representatives make up nearly a third of the directors serving on the Baltimore Convention and Tourism Board. Hotels in the city and across the state are heavily invested in tourism and convention business since it has a significant impact on us. We hope that the Baltimore Convention Center may be maximized as a source for driving hotel demand in Baltimore City and in surrounding jurisdictions in the future. we are concerned by reports referenced in my written testimony that Baltimore has lost both past and future convention business to cities with newer or larger buildings. From 2013 through 2029, we have lost 389 events worth 1.8 million room nights and 695 million in economic activity. That's significant, and the number is growing. When Baltimore loses conventions, it's a loss for hotels, but it goes far beyond our industry. It's a loss for restaurants, entertainment venues, transportation, and other businesses that benefit from visitor spending. It's also a loss for the city, state, and surrounding counties as the tax impact from visitor spending that is never realized. And this also impacts the quality of life for Maryland residents. We know investment is needed, and we hope to be part of future conversations through this task force. We view its establishment as a critical step toward enhancing the competitiveness of the BCC in the future. We respectfully request a favorable report. Thank you.
Thank you, Amy. I have Nashona Kess. Is that, no? Lisa, you're favorable with amendment. I'm going to get to you.
Oh, no, my amendments are the sponsors
Okay.
amendments, so I'm fine.
Thank you.
Thank you. My name is Nashona Kess with the Maryland NAACP, the Executive Director. I'm here today to talk about how crucial this particular legislation is to the NAACP. Currently, we have put in a bid to have the national convention hosted out of Baltimore. And despite the a lot of the incentives that were provided by the city with the help of Visit Baltimore, the national body is saying that the convention center is just outdated and the hotels are severely outdated. And so that is keeping us from winning the bid to host the national convention, which has the potential to bring in millions of dollars to the city. We are in competition with larger states that have, similar size states rather, that have more updated features, right? And so of course, we're still in the running. We tried to run for 2 years. They knocked us out for one of them. We're still in the running for 1 year, and we're hoping to get that. But we do have competition, and they're really hammering down on the fact that we don't have any, we just don't bring any upgrades. There's just not a lot of things, and they would have to spend a lot of money to bring it to Baltimore, right? And a lot of our members are saying that the hotels are just not feasible for them. So this is important to us. This legislation, I think, and of course, bringing tourism to Baltimore is going to bring a lot of economic opportunity. So thank you.
Is Matt here, Matt Lieber?
Madam Chair, if you don't mind, I'm being called an EHE for a bill.
Okay, thank you.
Thank you.
It's a busy time. Thank you, Senator.
Madam Chair, member of this committee, thank you for having me today. My name is Matt Lieber. I'm the legislative chair for the Maryland Tourism Coalition. As my colleagues have echoed, the convention center is a tourism hub for Baltimore City, and it's not just what happens in the convention center, it's what happens around it. So if you've ever been in Baltimore when there's a major convention going on, it's tough to get into a restaurant, it's tough to get into a bar, it's tough to get into retail because there's so many people here. When we're losing those events, that hurts all the businesses around the city. That means people aren't going to the casino, they're not going to Topgolf, they're not going to Fells Point and Federal Hill. So it's important that the convention center in Baltimore is thriving and vibrant and is up to date, and we're at a competitive level playing field with other cities. Just to kind of give you an idea of how important tourism is to Maryland, $19.4 billion visitor spending each year. That saves Maryland taxpayers about $1,000 per household. We employ 187,000 plus people in the industry. We collect $2.3 billion in taxes. That covers almost 31,000 public school teacher salaries every year. So in order to keep that going, we need to make sure that the Baltimore Convention Center can compete for these big conferences that we've been losing for years. So we need to put the money in, figure out how this needs to be structured properly so we can move forward, get the renovations that need to be done, and compete with all these other cities that are just going right past us when they don't need to be. Thank you for your time, and we ask for a favorable
Lisa?
Sure. Good afternoon, Madam Chair, members of the committee. I'm Lisa Harris Jones. I'm here on behalf of Visit Baltimore. Representatives of Visit Baltimore would be here today, but it's the CIAA tournament, which is a big deal for Baltimore City. And it points to why this piece of legislation is very important. We have CFG Arena, we have all this development. Baltimore it's a renaissance for Baltimore. And so a group of us got in a room working with the mayor's office and stakeholders, and we thought that the best solution, instead of trying to figure it out, and there are ideas going around, that we needed to put together a task force and put the right people in the room, put a timeline on it to report back to the General Assembly. I think it's to the governor and the city of Baltimore, the mayor, with a decision on what's the best governance mechanism, what's the best way to operate the convention center. And with all of that information, it'll lead us to the best path of financing the redevelopment and revitalization of the convention center and the adjacent properties, which would include the hotels. So this is a very important piece of legislation. The clock is ticking. They've already shared everything that I was going to say. So I don't have to repeat what we've lost with respect to conventions, and we're asking for a favorable report.
Thank you. We have a question from Senator Guile.
Yeah, thank you, Madam Chair. I know that the sponsor, Senator Carter, had to step out, so I'm not sure who would be best to direct this question, but I'm going to do my best. So I mean, I thank you for this bill. It's a really exciting time, you know, in Baltimore. I used to live down the street from the convention center in Otterbein, live in Anne Arundel now, but I'm really excited to see this being done because it's very needed. I'm wondering, when it describes like this, like the surrounding area, does that include, I know there's work being done or some plans on the Harbor Place and the Inner Harbor. Would that also cover that area too as well?
So in drafting the bill, the convention center and the adjacent properties, they're actually in law. So we had to make sure that when we put together the task force, to make sure that the authority was looking at the proper, I don't know, the property, or your land use attorney. So we wanted to make sure it captured the actual complex, the adjacent hotels. And so I think that's what you're probably pointing to in there.
Okay.
Did I answer that? Does that make sense?
I'll just add, to answer the question, does not include Harbor Place. We explicitly excluded Harbor Place from consideration for this task force to review the authority model, although obviously Harbor Place is going to be aligned with the tourism goals, and hopefully that'll be a draw to convention business once Harbor Place is redeveloped.
Okay, good. Thank you. Appreciate it. Thank you, Madam Chair.
Thank you. I have a question. I think I'll send it to Amy if you can pull the microphone over. So most conferences that we go to nationally, the hotels are big enough that you're in the hotel and the conference center is usually on the lowest level of the hotel. Is that something that's going to be considered maybe as the task force looks at having the hotels connected directly to the convention center? Think? No?
Well, Mac may be better suited to answer this for me, but you know, from when I'm speaking on behalf of the hotels throughout the entire city, there are small hotels that maybe are not large enough to host conventions like what you're talking about. And they are looking for the competitiveness of the Baltimore City Convention Center just to be increased so that there are citywide conventions where their rooms are booking.
Okay.
I mean, I would say that there's already ideas and sketches, and some work has already gone into it. And that's why we're here today. It's okay. We have ideas. We have thoughts on how this could work. So how are we going to operate and govern and pay for it? And that's the piece that's missing.
Yeah, I would just add that we were very intentional with having a third party review what industry best practices are, not only from the independent operation of the convention centers themselves, but what's the adjacent relationship between the hotels, between the attractions? Are there parking facilities included in those authorities? How do we leverage financial long-term success for a facility like mine? We have to be thoughtful about revenue generation coming in. If you go to a place like Columbus, Ohio, they actually have two hotels. They're not the meeting space isn't underneath it, but they're glued together, right? So you really don't know when you've entered the hotel and when you've entered the convention center. You also have self-contained hotels that are very much like you described, where the meeting space is there. But when you're talking about conventions of our size that are, you've got patrons of 7, 8, 10,000 people, you actually need a block of hotels across the city, driving compression, increasing average daily rate, and driving tax revenue. So to answer your questions, absolutely, we will consider all things, because there are models across the country that speak to just that. And right now, we just want to bring forth the options for a collaborative approach to finding solutions.
Thank you for that. Senator Ellis, you have a question?
Yeah, thank you, Chair. And Matt, I think listen to you said that, is it the city owned the convention center?
Yes, sir.
Okay. So I think that got me thinking, I'm not sure how this works. So why do you need the Maryland General Assembly's authorization to have this task force?
Thank you for that question. So we are a city-owned, city-run convention center. However, 2/3 of our deficit is subsidized by the state through the Maryland Stadium Authority by legislation through 2029. The way that formula was comprised back in 96 or 97 was due to the fact that Baltimore City doesn't get its own sales tax. That sales tax is seen at a state level and is disproportionate to the tune of 2/3 of the economic impact for what happens under our roof. So that's how that kind of, and again, why we're asking for this task force, because there's so many vested interests that are connected to its success.
Okay, great. Yeah, thank you.
Appreciate it.
Madam Vice Chair?
Are you thinking about tearing down the current convention center? Or are you just remodeling it?
So great question. Currently, we are reviewing all options. We have options that would require, so the original building that was built in 1979, which we refer to as our East Wing, is still running on original 1979 systems.
Okay.
So some of the options that require us to be collaborative to kind of figure out how do we become this self-sustaining ecosystem would require significant construction. And in some cases could include the raising of the east building and redeveloping that site so that it could go up, because we're landlocked, right? We don't have the property to go out. So we would need to go up in that case. However, we are also considering what are the options of just kind of improving as is. It's not going to drive the economic numbers that all of these members of this panel really need, but we're not considering anything.
Yeah, okay. And I'm just curious, we just had opened a new arena with private money, I guess. And is that a thought that we could get some big donor and put the convention center in? Lisa might be interested in that and having her name on it.
Yeah, they had a really good lobbyist and attorney that worked on that. I know her personally.
Speaking on behalf of the city administration.
Yeah, just that way and I guess that's something that's the cart before the horse that I'm saying, because you'll all discuss all that and you'll come back and let us know, right?
Right. The city administration's position is we would not want to privatize the facility in that manner, but the vision, the issue that was raised in response to the last question is that the incentives are on the line currently. The city, as a city-owned building with a city operation, we are the ones responsible to invest in a new building, but the benefits to Florida, the region through sales tax and even the hotel tax to split amongst the city and Visit Baltimore. So having an authority that would actually be charged with aligning incentives appropriately to make the investments.
And just my thought, just for my 2 cents, is just make it really, really, really big. I tried to get.
So noted.
No, and I say that because a few years ago, I tried to get one of the car auction shows down there, and it was too small. So, I mean, these convention centers now are huge. So.
Yeah, so surprisingly, we're 1.2 million square feet. That's actually a mid-sized convention center. Our neighbors to the north in Philly and as well as DC are twice our size. So there are definitely smaller convention centers. We are not meager by any stretch, but there are much bigger, and to your point, can bring a lot more vibrancy downtown.
And to add to that, I mean, the mayor and governor are very competitive, and so losing out to cities that we wouldn't think are our peer cities, for the Midwest, for example, or Louisville is one that comes to mind. Like, you wouldn't think they would have a large enough center to take business from us, but that's the reality we confront ourselves with.
Okay, thanks.
I see no further questions for this panel. Thank you all very much. I have
Thank
one
you.
more person signed up favor with amendment, Mia Bloom or Blom. Is she here?
Oh, no, that's Visit Baltimore.
That's visible.
Yeah.
Okay, thank you. That ends the hearing on Senate Bill 896. Yeah, is this me?
999.
Okay.
I'm not gonna ask you any questions, but I have a thought. We have now Senate Bill 999, certified nursing assistants, licensing requirements and administrative updates. And we have Senator Bidle and Chairman Bidle, and then we'll bring Barbara Jacobs, Dana Kaufman, Jane Krenke, and Rhonda Scott. That's
That's
our
fine.
first panel. Then we have two other people that will come up next, I guess.
We might have everybody at once.
You want everybody? Allison.
And it's Friday afternoon and I'm looking at
Right.
with who's left in the committee, so I'll make this brief. Thank you.
Allison Sabrowski, Rosalie Griffith.
Yep. I think we have everybody, right?
We have.
Okay,
Okay.
thank you, Madam Vice Chair. We started working on, this Senate Bill 999 is about certified nursing assistants, and we started working on this last year. What we have discovered is Maryland is the only state that has a CNA, certified nursing assistant, and a GNA, geriatric nursing assistant, and our nursing homes and assisted living can only hire GNAs. And so it's made it very difficult in the hiring process. And of course, everybody's understaffed and looking for people. So what this bill does is it creates one track. Eventually, we're going to be in one track called a CNA with some training for the geriatric issues. It's taken a little while to do this because, you know, we certainly aren't going to penalize any CNA that's currently licensed. So it's going to be a transition period and the bill provides for that. So I'm going to make it brief. You've got my full testimony, but it's the end of the day. And I just want to say this is a very good bill and I hope we can have a favorable report. Thank you.
Whoever. Okay. You wanna go next? Okay.
Do good afternoon, Chair Bidle and Vice Chair Klausmeyer and members of the Finance Committee. I'm Barbara Jacobs and I'm here in support of the Senate Bill 999. And I particularly want to thank Chair Bidle for bringing this bill forward. I'm a nurse with 45 years of experience who retired recently as Chief Nurse Officer at Luminous Health Anne Arundel Medical Center. Prior to that, I was Chief Nurse Officer at Suburban Hospital in Bethesda, and I also served as President of the Maryland Organization of Nurse Leaders. I've been involved with, for almost 5 years, with a group of hospital chief nursing officers and nurse educators working to make recommendations for change in the CNA statute and regulations in Maryland. In the acute care environment, we were finding that new CNAs were not adequately prepared to work in hospitals because their training primarily occurred in the long-term care setting, like a nursing home. The recent CNA graduates who applied for hospital positions required significant additional training and all too often did not stay in the position after onboarding. Acute care nursing leaders began to advocate for hospital-based training programs and created an acute care CNA curriculum that was approved by the Board of Nursing. The hospital-based programs are only available for hospital employees. I'm proud to say that Luminous Health Anne Arundel Medical Center was one of the first to establish a program and has been very successful in training new certified nursing assistants. However, we offer this training to offer this training to entry-level staff from departments such as EVS, environmental services, or dietary, who are interested in continuing their education and to work in patient care. My goal with this work and the goal of my fellow chief nursing officers is to expand the number of assistants available and to better prepare CNAs to work in the acute care environment and also make sure that the long-term care CNAs are available also. We were happy to see this bill move forward. One particular provision of the bill will remove the requirement for nursing students or even a new graduate nurse to have a CNA certification and will allow them to enter the workforce more quickly and gain clinical experience. Again, the best gift that we can give bedside nurses and patients in their care is a well-qualified nursing assistant. We hope for these reasons, and I request a favorable report on Senate Bill 999. Thank you.
Good afternoon, Madam Vice Chair, members of the committee, and thank you again, Chair Vital, for this bill. My name is Rhonda Scott, and I'm here on behalf of the Board of Nursing to testify on behalf in support with amendments of Senate Bill 999. The board did work very closely with Chair Vital and stakeholders on the amendments, and we're excited to get behind this and that it's moving forward because we think it's long overdue. The board believes that the frontline direct care workers are critical to the nursing workforce. This bill allows for portability of certificate holders across the healthcare continuum. And as Maryland nursing assistants move towards meeting the federal nurse aid requirements, they will gain more employment options, thereby strengthening their labor in the market. The board's proposed amendments focus on maintaining some of the law's existing language that functions to protect the public. The amendments also seek to provide a reasonable timeline for the implementation of the one designation certification. This timeline will allow existing CNA-only training programs to have ample notice to adjust their current curriculum to include all federally mandated content. The proposed timeline would also permit the board to perform the necessary upgrades to its licensing system to accommodate the new CNA designations. The board believes that passing this bill will align Maryland with many of the other states that have one nursing assistant designation that meets the requirements under both federal and state law. The board respectfully urges the committee to issue a favorable report to Senate Bill 999 as amended. Thank you.
Thank you.
Thank you, Vice Chair Klossmeyer, members of the committee. My name is Dana Kaufman. For the record, I'm here on behalf of Lifespan Network and also the Maryland National Capital Home Care Association and the Hospice Network. We also want to thank Chair Beidel for working with us since last session to get this bill before you. It is unfortunately complicated and is going to take some time to really transition to the one designation, because we also want to make sure that we do not disrupt the workforce right now that we have, so that the current CNAs who are working but don't meet the federal requirements can continue to work and meet those federal requirements, or can continue to work while we're transitioning and having any new graduates make sure that they meet those. So we've been working on the amendments, and we're very happy to see this bill finally coming due, and we request a favorable vote. Thank you.
Good afternoon, members of the committee. My name is Jane Krinky. I'm here on behalf of the Maryland Hospital Association in strong support of Senate Bill 999. Again, echoing everyone, just a me too. Really thank Senator Beidel and the board and everyone working together. These amendments address our concerns, and we ask for a favorable report. Thank you.
Hi, my name is Allison Siborowski. I'm here today on behalf of Leading Age Maryland. Thank you to the committee and Vice Chair Klossmeyer, and thank you, Chair Beidel, for putting this bill forward. We request a favorable report on Senate Bill 999. I agree with everything that has been said at this table, and it's Friday afternoon, so I'm not going to make this long. I just want to say that this bill makes a lot of sense. We're really excited, and it will be helpful for the workforce in Maryland. So thank you. We urge a favorable report.
Questions? And everyone's taking their turn, right? So
thank you.
This is a great bill.
Thank you.
That ends this bill. We have Senate Bill 809, Dorchester County applicants polygraph examination. Senator Mounts.
I'm tuning in right now.
Wait, I mean, I should have said, bring up your panel.
Madam Chair, distinguished colleagues, it's an honor to be here and present Senate Bill 809. I am the panel, and unfortunately, I am the delegation. So we have it covered. there is a prohibition on requiring a polygraph with many exceptions in the Maryland Code. And Dorchester County has decided that they need this authority for certain positions, specifically 911 center dispatchers, a correctional officer of the county detention center. For those two positions, they are seeking this authority. I wanted to read that slowly. I'm going to read and there's a longstanding practice in Dorchester County where this has been a condition of employment. And the question has come up, well, why is that needed? And there's been issues with personal information and sensitive things that occur in those lines of work. And they just want to make sure that the employees that they are bringing on board are of the highest level of trustworthiness. And so they respectfully request that we grant the county this authority. I would also like to suggest that TGIF to everyone for still being here today.
For the senator or his panel or his delegation.
I would like to note that the file says mandatory polygraph. This is not mandatory. It will be for certain positions. It won't be a mandated thing. It's something, it's a tool that they'd like to be able to utilize if they need it.
So it would be optional. Is that word, no, seriously, is that word going to be all right though? Mandatory?
Yeah.
So it won't get caught up in some other person's. No.
It has been thoroughly vetted by the county attorney. And they're very comfortable with the way that it's drafted.
Okay. All right. That ends this bill, the hearing, and the that's it for the day.
Have a nice weekend, everybody.